So
okay,
should we start? Should we start?
Yes.
Yeah. Okay, so welcome everybody to the third Renmin GLO workshop. It would obviously have been really nice if we were in Beijing right now, but we are here. But I'm sure, and I have really fond memories of the second workshop that we last year when we were there. But I'm sure we will have a rewarding experience today as well, because we have a very interesting program today and a number of very interesting papers throughout the day. So it will be quite a rewarding experience, I'm sure. I mean, the program was put together, and thanks to Zong and Klaus, it was put together at a very short notice. And obviously, Corrado has been an architect of this from the start of this Renmin GLO workshop, and so it was very nice that all of you were able to put a program together. So it's exciting to be to continue this tradition of these workshops, and it's really great that we, with all the pandemic and all of the other kind of pressures on time for us, we are able to put this together just before Christmas. So what we have is 2 sessions pretty much, and the first session is going to be chaired by Liqiu Zhao. So I'll pass on the screen, so to speak, or the virtual floor to Liqiu in a minute. I hope I'm pronouncing the name correctly. But just as usual, the 2 things that I always say when we have these virtual seminars. One is that it is being recorded, as you probably heard anyways, the discussion we just had. So we'll put probably on this the whole session or maybe individual presentations on the GLO website. So just that it is being recorded. And the second thing is that please put your questions, use the chat function to put your questions during the presentation. And then I think the structure is that people present first and then the questions in the last 10 minutes. Is that right, Corrado? Is that, yeah, so last 5 minutes or whatever. So unless you have a kind of a clarification question, and just unmute yourself to ask maybe clarification question, but anything discussion related should be towards, at the end, maybe 5-7 minutes at the end of the presentation. And please click mute when others are presenting, so that there is no kind of extra noise coming when people are presenting their papers. So I'll pass on now the screen to or the floor to Liqiu, who can kick off the first session. Thanks again for joining, and I know it's different timings, mostly in China, but other places as well. I see a couple of people in the US as well, so it's great to see so many of you here. Thanks very much, and we start with the first session. Liqiu, you are.
Sorry, I forgot to unmute my microphone. Good afternoon or good morning for our friends in Europe. I'm honored to chair the first session of this virtual conference. So in this session, we have 3 speakers. Each speaker has 45 minutes, including questions and discussion. So for those who'd like to interrupt and raise questions, please remember to unmute your microphone before you speak. Our first speaker is Shu from Renmin University. Let's welcome.
Okay, thank you. Let me first share my screen. Okay. Hello, everyone. I'm Shu Cai. from Renmin University and affiliated with Global Labor Organization. It's my great pleasure to present the paper co-authored with Professor Zimmerman, titled as Social Assimilation and the Labor Market Outcomes of Migrants in China. This project is still very preliminary, and therefore comments and suggestions are more than welcome. As noted by Akrof and Cranton in their book Identity Economics, published in 2010, quote, in every social context, people have a notion of who they are, which is associated with beliefs about how they and others are supposed to behave. These notions play important roles in how economic works. In this study, we are trying to examine how social assimilation of migrants in China affecting their labor market outcomes. Migration is an important engine of increasing aggregate productivity and promoting economic growth. Economic assimilation of immigrants have received considerable attention from economists. The social assimilation to host society is less examined, but there are a growing literature on this perspective. And the literature finds that the social assimilation to host society is important for migrants' labor market outcomes and well-being. These include studies from Akrof Crawton and a couple of papers by Zimmerman and Constant and the other causes. However, the literature on social assimilation has focused mostly on international migration, while it's neglecting the internal labor mobility, which may potentially facing different challenges. China is experiencing the largest internal migration in the world, but very few existing literature have examined migrants' identity. How does social assimilation affect migrants' labor market outcomes in China is a question this study tried to answer. To measure the identity of migrants, Constant and Zimmerman have classified the international migrants regarding their ethnic identity as assimilated, separated, marginalized, and integrated. Those assimilated migrants are those who consider their identity affiliated to the host country or places, while the separated migrants are those who still consider their identity belongs to their home country, while the marginalized migrants think they belong to nowhere, and the integrated migrants consider them to be close to both culture of host and sending country cultures. Different from this conceptual rest in the literature, international migration in China focusing much more on the alternatives to assimilate or to keep the identity of original region. Based on the data we used in this analysis, we find very few of the migrants consider them to be marginalized or integrated. There have been several theoretical attempts to examine to frame the impact of social identity on economic outcomes. This include Akrof and Cranton's model, which they extended the utility function by including a person's sense of self, namely identity. In order to achieve a better self-image, individuals may choose a suboptimal choice, but their overall utility is maximized. For instance, people might be willing to pay an income penalty in choosing an occupation in order to reinforce their identity. Better et al. In 2007 developed a model in which non-white individuals determine the level of adaptation to white culture by balancing peer pressure from same race friends and beneficial effect of their high-quality jobs through white society networks, which do not suffer from discrimination. Starting from the, there are several empirical studies examining the relationship between migrants' identity and the labor market outcomes. Constant Zimmerman found that the host society identity has positive correlation with employment for immigrants in Germany, which is confirmed by the study by Casey and Dustman. Better and Zeno found that the employment penalty, there are employment penalty for immigrants' oppositional identity experience. Using genetic difference as instrumental variable for the social simulation, Islam and Resky found that there's no causal impact of ethnic identity on labor market outcomes for immigrants in Canadian, which is also found by Glonia, where they found that ethnic identity has no significant correlation with labor market outcomes. The theoretical literature have emphasized the role of network as a channel of how immigrants' identity may affect labor market outcomes. However, there are certain empirical evidence on this perspective. This study found that social simulation significantly increases the hourly wage and reduces the average hours worked per day. It also reduces the likelihood of being overworked, and finally keeping the monthly wage unaffected. The improvement of labor market outcomes are mainly because that social assimilated migrants are more likely to interact with local people and find jobs with help from the local networks. This study contributes to the literature in several aspects. First, it examined the identity of internal migrants in the largest developing country. It used multiple dimension measures of labor market outcomes. While most previous studies have been focusing on employment, this study extends to examine labor market outcomes, including working hours, likelihood of being overemployed, hourly wage, and monthly earnings. It also provides causal evidence of how migrants' identity affecting labor market outcomes. Finally, this study highlights the role of local network on explaining the labor market advantage of assimilated migrants. Before I'm going on, is there any question regarding this, this project? If not, I will continue. After the introduce of background and data and amendments, I will present the strategy used for the empirical analysis. And then I present the main results. And we're focusing on the mechanism analysis with some extensions of the results. Finally, I will conclude. As most of you have been familiar with that, China has experienced a massive flow of migration from the rural to its urban areas, from the interior areas to the coastal areas. An estimated of 245 million of migrants in 2013, according to the National Bureau of Statistics. This number is 10 times the size of immigration during the age of mass migration from the Europe to United States. Even though the large volume of migration, there are substantial difficulties of social assimilation in China due to the vast cultural differences, and in particular, the institutional restrictions, such as hukou system. One of the cultural difference is the dialect difference. Even though China has a unified written system, its spoken language varies substantially across regions. while the similarity of dialects between regions is informative about the historical interaction, and this indicates similarity in cultural identity. In this study, we use the data from Dynamic Monitoring Survey on Migrant Population of China in 2013. It is conducted by the National Health and Family Planning Commission of China, which includes detailed information on migrants' demographic and social characteristics, as well as employment, income, migration experience, and etc. It conducted in 8 prefectures, 68 counties, and 844 villages or communities. The survey focused on migrants aged between 15 to 59. In the analysis, we restrict the sample to all employees. In total, we have nearly 10,000 observations. This figure illustrates the location of province and prefectures in the sample. These include
It's okay.
Any questions? Okay. This includes Songjiang district in Shanghai, Suzhou and Wuxi in Jiangsu province, Quanzhou in Fujian province, Wuhan in Hubei province, Changsha in Hunan province, and Xi'an and Xianyang in Shanxi province. In addition to the survey data, we also use a linguistic distance data, which is based on the linguistic data of local dialects from the Chinese Dialect Dictionary. The dictionary identifies 10 dialectal supergroups, 20 dialectal groups, and 105 subgroups. It classifies each county in China to a dialectal subgroup. We measure the linguistic distance between the county pairs and coded the linguistic distance between the two counties as 0 if they are in the same subgroup, and equals to 1 if they are in different subgroup but the same group, and equals 2 if they are from different groups but the same supergroups, and finally the distance equal to 3 if the two counties are from different supergroups. Therefore, the higher the value, the longer linguistic distance between the two counties. Since in the survey data, we only know the original province of the migrants, we use the dialect distance between two county pairs to construct the linguistic distance between the residential county and the original province of migrants, which is weighted by the population of each county in the original province in 2000. To measure social assimilation, we based on the questions, quote, which of the following type of identity do you think it belongs to, quote. The answer include local citizen, no local citizen, the citizen of your hometown, and do not know. Interestingly, in the sample, we find very few of the migrants characterize them. They do not know their citizenship, their identity. So, in other words, the number of those who cannot decide is only 3%. Therefore, we drop these observations from analysis and define a variable of social assimilation by a dummy, which equal to 1 if the answer is local citizen or new local citizen, and 0 if they think they are citizen of their hometown. In the sample, there are 45% of the migrants, of the employees, consider they are affiliated with the host region. The sample report compared the labor market outcomes and demographic characteristics between the group of assimilated migrants and those non-assimilated migrants. As shown in panel A, compared to the non-assimilated migrants, assimilated migrants tend to have higher monthly wage, higher hourly wage, and lower working hours, no matter in terms of average days worked per week, or average hours worked per day, or average hours worked per week. The assimilated migrants also tend to have lower propensity of being overworked over 5 days per week, or over 8 hours per day, or over 40 hours per week. These two groups are also different in terms of demographic characteristics. For instance, the assimilated migrants are slightly older than the non-assimilated migrants. They are more likely to be married, and they tend to have higher level of education. In addition to the mean difference, these figures illustrate the distributional difference between the two groups. The solid line represents the assimilated migrants, while the dashed line represents the non-assimilated migrants. The upper left figure shows that the assimilated migrants tend to have lower average hours per week than the non-assimilated migrants. While the upper right figure shows that for the assimilated migrants, they tend to have higher hourly wage. They also tend to have higher monthly wage, as reflected by the figure at the bottom. Formal tests on the distributional difference suggest that these two groups are significantly different in terms of all three measures at the significance level of 1%. To formally examine the relationship between social assimilation and labor market outcomes, we use equation 1 as our main empirical specification, where YICP represented the labor market outcomes of migrant I who currently residents in county C from a province of P. And the simulation is a dummy equal to 1 if individuals feel that he or she belongs to the local citizen and 0 otherwise. The capital X is a vector of control variables, which include age, age squared, male dummy, marital status, and educational categories of the migrants. Delta C is the current residential county fixed phase, and delta P is the original province fixed phase. Epsilon ICP is the error term, which allows for correlation within the unit of sample unit, namely the community. So the parameter alpha 1 is the parameter of our interest, which indicates the relationship between assimilation of labor market outcomes. However, the simple Earth regression could be biased due to omitted variable or reverse causality. For instance, people with better labor market performance may tend to more likely to assimilate to host places. To address the potential endogeneity problem, we use IV estimation. Specifically, we use the distance between the language spoken at the residential county and the language spoken at the migrant's original province as the instrument for social assimilation. As been mentioned earlier, the linguistic distance potentially illustrates the cultural difference between the host and the original places, which may affect the social assimilation process of the migrants. Therefore, we expect the longer the linguistic distance, the less likely the migrants assimilated to the host places. That, in other words, we expect beta 1 would be negative. The identification assumption of the estimates is the excluding condition, which is the linguistic distance affecting the labor market outcomes of migrants only through some social assimilation. One concern about this assumption could be that linguistic distance may affect labor market outcomes through individuals' language skills. To address this concern, in a specification, we control for individual language skills. Basically, we control for two dummies indicating whether they can speak the local language and whether they understand the local language in the regression to take account of the communication effect of language and to isolate the variation from cultural difference explored in the IV estimation. The table reports the association between the social assimilation and the labor market outcomes based on simple OS estimates. As shown, for social assimilated migrants, they tend to have higher hourly wage and low working hours. They also tend to have low probability of being overworked. In terms of monthly wage, the coefficient of the association is positive. However, it's not statistically or economically significant. To address the potential indemnity problem, we use the IV estimates. Panel A reported the main results from the two-stage least square estimation. Column 1 reported the first-stage estimates. As shown, the linguistic distance is significantly negatively correlated with social assimilation. The strong first-stage relationship indicates there's no weak instrument problem. Based on the IV, we find from the second stage estimates, we find assimilation increase monthly income and hourly wage, although it's not statistically significant. Assimilation significantly decrease the work time, particularly work time per day. As for a benchmark, the mean of the work time per day in the sample is 9 hours per day, while for the assimilated migrants, this average hours worked per day reduces over 1 hour, and which is statistically significant. Assimilation also significantly decreases the probability of being overworked. For instance, the mean probability of being overworked by over 8 hours per day is around half of the sample worked over 8 hours per day, while social assimilation significantly reduces the probability by about 0.44%, or in other words, it's completely cancels out the probability of being overworked over 8 hours per day. The results are robust if we control for individuals' language skills, as shown in panel B. First, from the first column 1, we find that individual language skills has positive association associated with social assimilation. Conditional on the individual language skills, we find the linguistic distance have independent rule on social assimilation, which indicated the cultural effect of linguistic distance. And by conditional on the individual language skills, we find the estimates of social assimilation on labor market outcomes are robust. If anything, these estimates seems more stronger. So to examine through which channel social assimilation affecting labor market outcomes, we are going to dig into into the mechanisms, mainly from three perspectives. First is the social interaction. Second, the neighborhood choice. And the third, the job searching, the network in the job searching of migrants. This table shows the impact of social assimilation on social interaction and the neighborhood choice of migrants. As shown in column 1, 2, 3, and 4, 1, 2, and 3, social assimilation significantly reduces the probability of interacting with people from the same region, while it is significantly increasing the probability of interacting with local people. And social assimilation also significantly increases the probability of having a neighborhoods, having a local neighborhoods, while it significantly reduces the probability of having a non-local neighborhoods. And more interesting, when we look at the impact of social assimilation on the network involved in the job searching, we find that social assimilation significantly increasing the likelihood of finding a job through local people by 70 percentage points. It significantly reduces the likelihood of finding a job through families, relatives, or friends. We also find that social assimilation tends to increase in the likelihood of finding a job by their own. Consistent with the literature, we find that social assimilation has no impact of obtaining a job through the help of government or social agency. So this analysis suggests that the assimilated migrants tends to interact more with the local people and choose a neighborhood near the local people, and they tend to involve more help from the during the job searching. They tend to involve more help from the local networks. So to examine, we know that there are job segregation for the local and the migrant people. To examine to what extent the local network helps the migrants, stimulate migrants in their labor market performance, we control for several job characteristics, including occupation, industry, and the unit type. By controlling for these characteristics in our main specification, we find here reports the coefficients after controlling these characteristics. At the bottom, I copy the estimates from the main results. By comparing these two sets of results, we find that the impact of social assimilation on labor market outcomes tends to be relatively smaller in terms of absolute values. These indicate these job characteristics can partially explain the labor market impacts. However, even conditional on these characteristics, we still find significant positive impacts on hourly wage or negative impact on our working time. This suggests that there are still substantial differences in job quality, even within the same occupation, industry, and unit type between these assimilated migrants and non-assimilated migrants. So the above results have been shown that social assimilation have significant impact on improving the labor market performance of the migrants in China. To examine to what extent to examine the impact further, we also examine the impact of social assimilation on migrants' subjective attitudes and their perception of local people's feeling about the migrants. So in the questionnaire, there are a couple of questions asked directly to the respondents. For instance, they asked their willingness to be neighborhoods of the local citizen. And they are also asked about their perception of local people. For instance, as shown in column 6, these respondents asked whether they feel that local citizens willing to accept themselves to be one of them. So by examining the impact of social simulation on these attitudes and perceptions, we find that social assimilation migrants tends to have significantly more willing to be neighbors of local citizens, and they feel they belong to the host places, and they are more willing to marry with local citizens. And interestingly, they are also more likely to feel that they are accepted by the local citizens. In addition, we also examine the heterogeneity of the impact by the margin of gender, age group, and education, a level of education of migrants. We found some interesting differences along these dimensions. For instance, for female migrants, as illustrated by the main estimates here, we find social assimilation reduces their work hours or the likelihood of being overworked over 8 hours per day. But for male migrants, we find that which is illustrated by both the main coefficients and the interaction coefficients. For ease of interpreting these coefficients, we reported the sum of these two coefficients, which represent the impact of simulation on labor market outcomes for the male migrants. So as shown by these estimates, for male migrants, social assimilation not only reducing their work hours, but also increasing their hourly wage significantly. And when we look at the heterogeneity along age of the sample, so we divided the sample, also we coded the migrants to be young if they are aged younger than 30 years old. We find that there are no notable differences of the impact between the younger migrants and the old migrants, relative older migrants. We, in panel C, we will look at the heterogeneity across level of education, and we code the migrants to be highly educated if they have education level of college or above. We find for those low education migrants, social assimilation significantly reduces their work time and reduces their propensity of being overworked. It also raises their hourly wage and raises their monthly income. For highly educated migrants, as reported by the parameter alpha-1 plus alpha-2, we find that there's no significant impact on their work time. And whereas there are significant negative impacts on hourly wage and monthly income for those highly educated migrants. For conclusion, this study examined the impact of social assimilation on migrants' labor market outcomes in China. And by using the linguistic distance as an instrument variable, we find social assimilation significantly increases migrants' hourly wage, reduces their average working hours, and the likelihood of being overworked. And the main mechanism is that social assimilation significantly increases the propensity of interacting with local citizens and living in a place where with abundant local neighborhoods. And it also significantly increases the likelihood of finding jobs with help from the local people. That's all. Thank you for your listening. Comments and suggestions are welcome.
We have about 9 minutes for questions and discussion. So I would like to kick off. I have 2 questions for you. The first question is, so in your study, the IV is the linguistic distance between the dialect in a residential county and original province, right?
Yes.
So I think if you identify the original region at province level, you may have problems because, for example, in provinces like Zhejiang, it has many dialects. So I think your linguistic distance will be measured with large amount of measurement error. This is the first question, and my second question is, I think the linguistic distance is the choice of migrants. And it's endogenous. So how can you treat this variable as the IV for social assimilation?
Okay. Thank you for the comments. First of all, so we only know the original province of these migrants from the survey, and to capture the likelihood of a person from a specific country, we use the population as in initial population distribution of the county in this host province, in the original province as weights. And yes, yes, you are true that there are potentially measurement error in our IV measurements. If this measurement error is classical, then it will tend to reducing the estimation power of our first stage. But luckily, we still got very strong first stage results, and the F statistics is not that small. It's around 60. In terms of your second question, whether this measurement error affecting the this identification depends on how that may affecting how this potential errors in measurement correlated with our main outcome, right? We didn't have any concept or conjecture about that may systematically related with outcome variables from some theoretical point of view. Regarding your second comments, the linguistic distance we measured some kind of, you say is endogenous determined or choice by the migrants, but I think it's not language skills. It's not whether you can speak a local language. It's been measured by the distance of linguistic of language between our dialects, between the host county and the original province. It's more subjective, or it's rather not controlled by the individuals themselves. So I don't think that may lead to potential endogeneity issue or violate the exclusion condition.
There is a question from a message box. It's raised
Yes.
by Faye. Is it possible that smaller linguistic distance helps migrants find better jobs through, say, networks, and as a result, the migrants feel themselves as local? A subjective feeling to me is like an outcome, not a driving force.
Yes, we consider the networks as a main as the channel through which social migration, social assimilation may affect in labor market outcomes of the migrants. So it's not a violation of the exclusion condition. We consider that as mechanisms.
Hi, Corrado. You can mute your microphone and ask questions yourself.
Thank you. So first of all, this is very interesting. I like the idea how you explore channels. I have a couple of general points and questions. They're both related to identification, but also a little bit conceptual. So I think my concerns about the IV are actually more generalistic, because the way in which you construct the IV, it's really basically defining bilateral, if you want, dummy, which define a relationship between a county and a province. And basically this dummy can capture any type of bilateral difference, right? So it's not just linguistic distance, but technically speaking could be, I don't know, historical distances, trade between these areas, right? Between county and province and so on. So I think that puts more pressure on you in thinking carefully about why you want to exclude these dummies conceptually from the second stage, right? Because it's not so, right? So it's not really just linguistic distance. It's anything unobservable that links that province and that county, yeah? So that's the first comment. The second still relates, your second, let's say, version of the IV has actually uses as instruments two variables that are actually, to me, much more endogenous. So I would actually not use them, I think, in the first stage and just, use them in the second stage. If I saw correctly, you're using the language that you speak, whether you speak or not the local language as a first stage. I think that's wrong. It should be at the best used as a control variable. The third, yes, however, conceptual sort of argument here, I think you may want to go back and think whether by selecting only employees here, you're forcing selectivity in your data. And my argument would be that there could be individuals which you leave out of the sample, which could be those eventually who feel, more segregated, or they are less likely to feel citizen, if you want, in the local area. And they might want, because they don't feel integrated, they might want to select some different type of jobs. And as we know, markets are very segmented, and they might end up in working in informal sector, for example, and become self-employed in some sort of informal sector. We know those type of self-employment, they're typically related with low socioeconomic outcomes, and individual might make this type of choices. So I was wondering if you can comment on these points. Thank you.
Okay, thank you very much for your comments. And I really appreciate for your for this. And regarding your first comments, yes, there are many. There are potential unobservable bilateral factors that may affect both credited with our instruments and the labor market outcomes. For instance, as you mentioned, the trade relationship between these two bilateral relationship. And to address these concerns, we have tried our best to control for the host county fixed effect and original province fixed effect. And although we cannot, previously cannot control for the host country and original province fixed effects, since our estimates are along that dimension. But yeah, you are true. I think we can consider to control for some kind of these bilateral variables if we can get some measurements from that. For instance, the geographic distance between the home county and the original province, something like that. And about your second comments, actually we are not using the language, individual languages as instruments as an alternative specification. Instead, we use the individual in the panel B, we only use the linguistic distance as instruments rather than using the 3 variables as instruments. So we take this as control variables rather than IV. And in your third comments about the selection of employees, yes, absolutely, absolutely true. We totally agree with that. There are potential selection problem of employees, and we have to some preliminary analysis on that. I think several potential ways to solve for this problem could be construct some selection model of being an employee do something like inverse probability weights to adjust for this potential selection bias, or using Heckman selection methods to addressing whether this have been seriously affecting our results. We do some preliminary analysis, find that there are indeed some difference between the likelihood the likelihood of being an employee and their social assimilation, as well as the labor market outcomes of employees and other type of employers or self-employment. So there are potentially selection problem, yes.
I think we are running out of time. So let's have more discussion during the break and move on to our second paper.
Thank you.
So our next presenter is Hong from Renmin University of China.
Shu, can you stop sharing your screen?
I think I have stopped.
Okay. Can everyone see my screen?
Yes.
Okay. So let me start. Well, it's my great pleasure to present our paper here. It's titled Early Childhood Exposure to Health Insurance and Adolescent Outcomes, Evidence from Rural China. It's co-authored with Huang Wei from National University of Singapore. This is the outline of my talk. It's a typical empirical paper. Let's first look at the introduction. More than 200 million children under age 5 in the developing world fail to reach their developmental potential due to poverty, poor health, and malnutrition. The lack of accessible and affordable health care may be an important reason. The literature has shown that the provision of public health insurance in early life can generate long-lasting benefits in developed countries. For example, better outcomes in later childhood, improved health, educational attainment, and economic outcomes in adulthood. However, those findings in the developed countries may not be applicable in the developing world. The studies on the short and long-term benefits of public health insurance among children in developing countries are quite limited, probably because of limited data availability, shortage of exogenous variation of health insurance coverage. Since the governments in low and middle income countries are considering to expand or just expanded the public health insurance programs, such empirical evidence is quite important for policymakers to evaluate these programs. in the limited studies on developing countries, they find little evidence on the health effects of public health insurance, even in the short run. The reasons include that first, health benefits may be limited for constrained funding in developing countries. Second, it's hard to isolate the health benefits from the contemporaneous access effect of health insurance. Third, more importantly, health improvement may be cumulative, affected by past and current investments. So in this paper, we aim to examine the impact of exposure to public health insurance in early life on outcomes in adolescence in rural China. Here, the early life is defined as the period from conception to age 5. Adolescence refers to the period ages 10 to 19. Well, there are two reasons that rural China is a good setting to answer the research question. First, most disadvantaged children live in rural areas of China. Second, the new cooperative medical scheme is one of the largest medical insurance programs in the developing world, and it was rolling out on a county-by-county basis from 2003 to 2008. Well, so basically we employ a difference in differences framework to identify the effects on a variety of health, cognitive, and educational outcomes in adolescence. Well, the identification is based on plausibly exogenous variation in early life exposure to NCMS, both within and between birth cohorts. Well, we find that exposure to NCMS in early life has significant impacts on adolescent outcomes. Specifically, we find that full exposure in utero to age 5 is associated with a 0.28 standard deviation improvement in health index, a 0.3 standard deviation increase in cognition, a 13 percentage point higher likelihood of school enrollment, and 1 more year of education. Compared to the Medicaid in the US, the NCMS exposure in early life has similar health gains, but larger educational benefits. But we have to, it has to be noted that the NCMS has much less financing and lower reimbursement rates compared to Medicaid. We further investigate the potential mechanisms by examining the contemporary impacts of the rollout of the NCMS. And we find that the NCMS introduction is associated with an improvement in prenatal care use among mothers and an improvement of birth weight of the children. We also find that the NCMS increases contemporaneous utilization of preventive care and lowers the likelihood of being sick or injured among children under age 6. The program also reduces exposure to catastrophic medical spending, improves durable consumption, and increases maternal time input and expenditure on childcare for households with children under age 6. So we think these findings of the paper can make several contributions to the literature. First, to our knowledge, this is among the first to show that public health insurance coverage offers health and educational benefits over a relatively long time period in a developing country. It provides some insights relevant to policy debates about whether to expand subsidized health insurance for informal sectors, especially children and young children in the developing world. For developed countries, our findings also add to the discussion about the short and long-term impacts of public health insurance expansion for relatively poorer people. Second, we provide new evidence for potential channels behind the lasting effects of early life exposure to public health insurance. As we all know that most of the major public health insurance programs were initiated much earlier, and the data on early childhood or the middle years are generally unavailable. Our findings on outcomes in early childhood and adolescence also help to understand how other public interventions in early childhood affect later adult outcomes. In the literature, other public interventions related to child health investments include malaria eradication in India, a deworming program in Kenya, subsidized childcare and child visits in Norway, additional medical care at birth in Chile, and safe drinking water in China. Third, our study is also relevant to the literature on public interventions and human capital policies targeted toward disadvantaged children. We find more benefits for girls and children from poorer households. And our event study analysis also show evidence informing the question of critical ages for intervention. It suggests that providing health insurance in the prenatal and 0 to 5 age period could yield much higher returns than coverage in later childhood. Finally, our contributions, our paper contributes to the literature on the SMRs in China by showing relatively longer-term effects. Most studies about this program focus on short-term impacts. They find a higher utilization of outpatient and inpatient services, more non-medical related consumption, higher school enrollment among 6-year-old children, no reduction in investment in children's education during negative health shocks, but they find no health effects even in the short run. Then let me briefly introduce you the background about the SMRs. Before 2003, over 90% of the rural population were uninsured. 1/3 of the rural households identified illness or injury as the cause of their poverty. So the government started the SMRs program in 2003. As we can see from this figure, the program covering around 11% of the rural counties in 2003 and 2004 is expanded to 25% in 2005, 50% in 2006, and to all counties in 2008. The program has a very high individual level coverage rate. It reached 92% in 2008. Well, this program is a voluntary public insurance program operated at the county level. Participation is at household level, financed by low household contribution and high subsidies shared between central and local governments. In 2011, the average financing was about $35 per person, of which 80% was from government subsidies. So it is a heavily subsidized program. It covers inpatient care, outpatient care for catastrophic disease, and some other outpatient care. The reimbursed levels are low because of limited financing. In some areas, an annual physical examination is also covered. Figure 2A shows the total financing and number of enrollees of the program from 2004 to 2013 based on the national statistics. And we can see the numbers of enrollees increase very quickly. From figure 2B shows that the fraction of rural children under age 6 with public health insurance increased from less than 10% to 91%, according to the data from China Health and Nutrition Survey. Well, we use 2 data sets for this study. For the main results, the longer-term effects of the NCMS, we use SAFE-FPS, China Family Panel Study from 2010 to 2006. It is a large-scale national representative longitudinal study conducted by Beijing University. We focus on adolescents aged 10 to 19 years, born between 1991 to 2007 with rural hukou. And we include only the sample that had local hukou, was born and resulted in the county at age 3 and at a sweet time. So that the sample is most likely to be eligible for the local NCMS program throughout the early childhood. So the sample includes about 13,000 adolescent with observations for about 6,800 unique adolescents. For each adolescent, we construct a measure of early life exposure to NCMS based on the year that each county introduced the program and the year of birth. So it is defined as the fraction of years exposed to NCMS from conception to age 5. And this figure plots this variable by birth cohort. Each bar represents one standard deviation above or below the mean. So we can see that there is substantial variation in early life exposure to the NCMS between and within cohorts. As for the outcomes, we have three measures of adolescent health outcomes: an indicator of not being in good health, an indicator of a hospital admission in the previous year, and an indicator of being underweight. We also aggregate the 3 measures, health measures, to construct an unhealthiness index. That is the simple average across across each health variables standardized z-score to reduce problems associated with multiple hypothesis testing. For cognition, we use 2 scores, a verbal test score and a math test score collected by CIPS 2010-2014. Both scores are standardized and calculated as age-specific z-scores. We have 2 educational outcomes, school enrollment and educational attainment. Although we know the adolescents may not have completed their education, educational attainment is still an important measure of child development. This table reports the summary statistics for the sample. The average share of years exposed to the NCMS in early life is about 16%. It is about 6.16. This is our econometric model. The empirical strategy is a DID specification. I denotes individual, C birth cohort, B C birth county, B birth cohort, T 3 year. Y indicates the adolescent outcomes. Exposure is the fraction of years exposed to SMS from consumption to age 5. It's only a function of the children's county and year of birth. X include a vector of individual and household characteristics, such as a quadratic of age, gender, parents' age, education, marital status, and family size. Delta is county fixed effects. Lambda is birth cohort fixed effects. Tau PT is province by V fixed effects. Theta P times B is province specific linear cohort trend. And this term, the last term, CBO2 times B, is the interactions of linear cohort trend and county level variables in 2002. We include this term to allow for the county the cohort trend to vary with the predetermined county characteristics that may be important determinants of the timing of the reform of the program across counties. So here the coefficient beta identifies how moving from no exposure to full exposure for children in utero to age 5, that means increasing the fraction from 0 to 1 affects their longer term outcomes in adolescents. Well, we focus on all rural children eligible for the program. So it captures the intention to treat effects of program. Another thing has to be noted that the cohorts without early life exposure were generally exposed to the program in their late childhood or adolescence. So the estimated effect, it should be interpreted as the effect of a marginal increase in exposure in early childhood, conditional on SMS exposure at old ages. This table reports the mean results for health and cognitive outcomes. Let's look at panel B, our preferred specification. This estimate implies that increasing from no exposure to full exposure in early childhood reduces the unhealthiness index by 0.28 standard deviations. Specifically, there is a 12 percentage point decrease in the likelihood of not being in good health. A 4.6 percentage point reduction in the likelihood of hospital admission. The p-value is 0.1. A 10 percentage point decline in the likelihood of being underweight. Well, for the two cognitive measures, there is 0.3 standard deviation increase in verbal test scores, but no significant change in math test scores. One possible explanation is that reading achievement is more affected by family and non-school factors, such as health insurance here, than a math achievement. Here, for two, let's look at the effect on two allocation outcomes. Full exposure to the program in early life leads to a 13 percentage point increase in the likelihood of school enrollment and 1 year increase in educational attainment during adolescence. We also report results for 2 subgroups, ages 10 to 15, ages 16 to 19, because younger children are generally subject to compulsory schooling laws. See, the estimated effect are larger for those aged 16 to 19. As a placebo test of whether the effects we are estimating can be attributed to the program rather than county-level time-varying unobservable factors. We also estimate the results for urban adolescents in the same county, because they are ineligible for this program. As expected, we find the estimates are insignificant for all outcomes and economically small in most cases. So it provides supporting evidence for the causal interpretation of our estimates for rural children. Then let's look at the subgroup analysis by gender. We find larger and significant effects for girls, except the estimate for self-reported house. We use mother's education to proxy household socioeconomic status before the program, and we also find the effects are more significant and larger in the lower SES group. In this figure, we examine differential effects by ages at first exposure. We replace the mean measure of SMS exposure with a set of dummy variables for ages at the SMS introduction in the county. So this figure is the reverse of a typical event study graph. The reference group is the cohorts aged 6 to 7 at first exposure. The event time -1 is when the SMS was introduced in the county 1 or more years prior to birth. So that is the fully exposed cohorts. So this figure highlights a systematical improvement in outcomes for those exposed to the SMS from conception to age 5 compared to the reference group. And there is an overall declining trend as age at first exposure increases. Then let's look at estimates of exposure in later childhood. They are small in magnitude and statistically insignificant. This provides no evidence for pre-reform trends in adolescent outcomes. In sensitivity analysis, we also conduct 2 pre-trend tests. First, we perform placebo tests using older cohorts, aged 6 and above, when the SMS was introduced, and assume that the program had been implemented 7, 8, 9, or 10 years earlier than the actual reform year. And we find no evidence in the placebo programs. And in the second pre-trend test, we compare pre-reform cohort trends in terms of male height, female height, male education, and female education across counties with different timing of SMS. Again, we find no evidence for differential pre-reform cohort trends across counties with different timing of the program. In robustness check, we also control for more confounding factors, such as more barriers of early life exposure to tap water, electricity, TV, phone, and public road, health supply, so school supply, one-child policy, migrant trends, or province by cohort fixed effects. And the results are mostly robust. We also try alternative measures of early life exposure, and we also use alternative sample of 1 observation per adolescent the results are also mostly robust. And we also discuss sample selection problem and find no evidence for attrition bias. To save time, I just skip this part. So let's look at mechanism analysis. We investigate the mechanisms using data from China Health and Nutrition Survey. So we have 6 waves of data, 2 waves before, 2 waves spanning the expansion phase, and 2 waves for full exposure of the NSMS. We look at rural children under age 6 or rural households with children under age 6. We also use some retrospective data on initial conditions at birth and the household economic status from CIPS in this part. Theoretically, health insurance exposure in early childhood can improve child development through several channels. First, it can improve mothers' prenatal care use and general health prior to conception, and therefore improve birth conditions of the children. Second, it can also improve young children's health utilization, prevent childhood illness, and reduce the severity of long-run sequelae. Third, it can improve household finance for those households with young children and led the households to make more resources available for children's nutrition, schooling, and an improved physical environment. So in this part, we estimate the reduced form impact of the introduction of the program in a standard DID framework. That is the short-term effect of the program. Here, the NCMS is an indicator whether County C introduced the program in year T-1 or T. Prenatal is the number of prenatal care for mothers between T-1 and T. In N, that's the current health or access of care of or access to care of children I observed in 3-year T. So first, let's look at the effect of the introduction of the program on rural mothers' prenatal care use and birth outcomes. We find that the NCMS coverage increased the number of prenatal examinations by 1.3 times. And based on the retrospective data in CIPS, we find that there is a 1.7 percentage point decrease in the likelihood of low birth weight associated with health insurance coverage in utero. And there are no significant effects on the likelihood of hospital delivery or premature birth. Second, let's look at the contemporaneous health and health care use of children under age 6. See, the introduction of the program has significantly reduced the probability of being sick or injured, increased the probability of using preventive care among children under age 6. Here, as for formal medical care use, this estimate is not significant, but when we restrict sample to those being sick during the past months, and we find an increase in the formal medical care utilization among young sick children. But this estimate is only marginally significant at 15%, probably due to the small sample size. And we also estimate results for rural children at ages 6 to 17, and we found no significant effect. Third, let's look at the effects on household finance. We we find that the program has reduced the financial burden of out-of-pocket expenditures measured by a share of household income on medical care. And also reduce the incidence of catastrophic health expenditure, no matter we use 10% or 15% as the thresholds among the rural households with children under age 6. There is an increase in appliance ownership, an increase in household expenditure on childcare, more maternal childcare time for children under age 6. Also, we estimate results for rural households with children aged 6 and above, and we find the results are insignificant, but there's an increase in nutrition intake. To complete the picture, we also estimate the association between children's early life exposure to the program and household economic status using our mean specification. We find that full exposure to the SMS in early childhood is associated with an increase in household total net assets, and an increase in household educational expenditures. We also conduct a back of the envelope calculation for cost benefit analysis. The total benefits include two parts: reduced costs from less hospitalization. It is estimated at about $685 US. And the total annual economic returns to improve general health and increase educational attainment when the adolescents enter the labor force are about 215 to 912 US. But the total financing cost of the SMS coverage per child during early life is about $411 US. So the benefits have far exceeded the total financing cost. The SMS for children in early childhood is highly cost beneficial. Then let me conclude the paper, the presentation. Well, we find that exposure to the SMS in early life has significant impact on outcomes during adolescence. The health benefits is of similar magnitude to those estimated for Medicaid and the food stamp program in the US. The cognitive and educational benefits are larger in magnitude than those estimated for Medicaid, and of similar magnitude to those estimated for treated water in rural China in the literature. And the benefits are larger for SMS exposure starting in utero and early childhood, but become negligible for exposure starting in later childhood. So the potential mechanisms include improvements in mothers' access to prenatal care, birth weight, contemporaneous utilization of preventive care, and household the reduction of household medical-related financial risk. So for policy implications, we think that our findings highlight the importance of intervention timing, and it has important policy implications for the ongoing public health insurance reforms in China and other developing countries that aim to improve population health and well-being. That's all. Thank you.
There's a clarification question from the message box. How do you define underweight in CFPS?
Underweight. So we used the growth chart from WHO for children, and we calculate the BMI as Z-score using the following the procedure suggested by WHO. WHO, and then we define if the BMI Z-score is less than -2. So the children should be classified as being underweight.
Okay. Any questions from the audience?
Hong? Yeah, I have a question. So it's a very interesting study, particularly because your mechanisms will highlight the financial risks playing on the development of kids, particularly those in utero development. Regarding the literature, there's also an aspect being highlighted in recent literature, which emphasizes financial pressure feeling by the mothers in utero during their utero period. So can you, in your data, can you think of any ways to illustrate or to illustrate this financial pressure effect?
Thank you for your question. I think it's a very good suggestion. But I think it's a very, I know in the literature it's a very important mechanism for the benefits of health insurance. So I'm wondering how to measure the financial stress of the mother. We in the self-payers data, we only have the measure for mental health at the sweet time, and that means the children are already in adolescence. So so I think in our for our mechanism analysis, we need the measure for the mothers during pregnancy or during the children's early childhood. But I don't think CHNS in CHNS there are such mental health or some measures for financial strains. So we only have the measures like the share of household income on medical expenditure. So we don't have the subjective measure of mothers for their financial strain. But okay. I think I will double check for this point. Thank you.
Thank you.
I have a question about your identification. So can you go back to your slides on your econometric model? I think the typical way in this case is that you include wave dummy, and then also you include the province by birth year physical fact. But here you include province by wave physical fact without control for wave physical fact. Why is that?
Probably we here as for province by wave fixed effect, we here we have wave fixed effects, province fixed effect.
But in this case, you cannot control for province by you cannot control for province by birth year fixed effect. Or you maybe want to control for province. Okay, you have province linear trend. Sorry.
Here here. Okay.
Yeah. Okay. I have no question anymore. But then I have another question that how do you know? Have you ever think about is your effect actually be driven by Xinlonghe or any other reform happen at that period instead of this Xinlongbao?
Yeah, I also construct in a robotics track. I also constructed the early life exposure to the pension, the rural pension program in the similar way as I defined for NC Mass. And I also added to the model and find the results are mostly significant, mostly robust. I included in the appendix as a robotics track. So I do think about it.
Okay, thanks so much.
Thank you.
Okay, thank you, Hong. So let's move on to our final paper. So the final speaker in this session is Li from University of Gothenburg. Hi, Li.
Yes.
Could you share your screen?
Yes, I hope everyone can see my screen.
Yeah.
Is it in full screen or not yet?
It's in a full screen, but it's much smaller than the normal full screen.
Is it better now?
It's not in full screen. You can click.
So I put on full screen now. Is it in full screen mode now?
Yes,
No,
I think so.
not yet.
Yes, it is so.
Huh?
It is so.
Okay.
Yes.
Okay.
Perfectly fine.
Okay, perfect. Okay. Yeah. So first of all, I would like to thank the organizers for organizing this conference. It's my first time participating in the conference. And today I'm very happy to present this work in progress joined with Ignacio Bo from University of York about the civil servants assignment in Imperial China. My talk today will be a bit different from the previous talk, as our paper is mainly a theoretical analysis. So to begin with, I would like to talk a bit about the bigger context of our of the focus of our paper. In real life practice, we know that randomization is often used in allocation or matching problems. A famous example that most of you already know probably is the US military draft lottery. So here is a picture of the very first US military draft lottery in 1940. A number is drawn randomly from the big arm in the picture in front of the public. And then basically all the men with the number were drafted to join the war. As we argue in this paper that there are two main reasons that we think why such kind of lots drawing procedure is interesting. First of all, it's transparency. When the stakes are high, drawing lots in public guarantees that the procedure is as non-biased as possible. So it gives legitimacy to allocation decisions. And the second reason is simplicity. So the mechanics of this lots drawing procedure that is used for determining the assignments are pretty simple, and it's very easy to understand. Of course, the US military draft is quite simple, as there are no constraints in the problem. So in our paper, we look at more complicated problem, which is the constrained assignment problems. And we provide a method which can be used in a transparent and simple way, that is by drawing random matchings from the arms publicly. And this design is in fact informed by our historical analysis of the lots drawing method used for more than 300 years in Imperial China to assign civil servants to jobs. In the paper, we also try to look at how to use the lots drawing method in different types of problems where some degrees of randomization is desired. For example, refugee matching, and then in some cases, when we are matching doctors to hospitals. And another application is public housing assignment. However, for the sake of China, I think my talk today will be mainly about the Chinese civil servants assignments, and I will be happy to talk about the other applications during the break or offline. All right, so let me begin with some background information on the Chinese civil servants assignments. We all know, I think, that China has a long tradition in state bureaucracy. So a large body of bureaucrats were recruited to run the daily administration tasks. And the selection of these bureaucrats at the very beginning was mainly hereditary, and then it moved to a more recommendation-based system. In 587, the civil servants examination was introduced. And so the civil servants examination system provides a systematic way to select candidates based on examinations. The selection by examination, however, at the beginning was used at a very small scale. It was not until Song dynasty that the civil servants examination became a dominant way of selecting officials, in particular the officials for the entry-level jobs in the administration. So we went through archives documenting the procedure about how they assigned these newly selected candidates to jobs. And it turns out that in Song dynasty, a type of serial dictatorship is used. So this is a much more formal procedure compared to the previous dynasty. The serial dictatorship in this case basically means that the candidates, they are ranked by their exam results in most cases. And so this forms a strict order of candidates. And then by one, the candidates are asked to select a job that they like among what is available. So in practice, after they announced what is their preferred job, the Ministry of Personnel, which handles the assignment, will chant out if it is approved or not. And then this procedure continues until everyone has at least tried to select a job. This procedure, however, was changed in Ming dynasty. So in Ming dynasty, candidates are no longer asked to express their preferences. Instead, they still give assignments one by one, following this strict order determined by the exam results. But the Ministry of Personnel will make a personal assessment and then basically tells the candidate what is the suitable job for each of them. And so in late Ming, the lots drawing procedure was introduced. I will come back to the lots procedure a bit more in details in a bit, but this is a quite big difference compared to the procedure that was used previously, as randomization for the first time was introduced. And the lots drawing procedure continued to be used in Qing dynasty with some modification. And this was basically used until 1906, when the whole centralized appointment system was abolished. Right. So before I move on, I would like to emphasize that our focus is mainly on the newly selected candidates. So they are suitable for they're usually ready to be assigned to entry-level jobs. So these are not for higher ranked jobs, or these are also not for reappointments or promotions in general. So we really had in mind to look at the first-time assignment. So the overall goal of the assignment is to find the right person for the right job. This is not, of course, we can have different interpretations for what does this mean. But over time, we saw that there are two what we call compatibility constraints that seem to reflect the goal of finding the right person for the right job. So the first one is rank compatibility. So the candidates, depending on their degrees, which can be advanced scholars, recommended men, etc., and their exam results, and they are eligible for different set of jobs. And in general, the higher degrees you have, you are more likely to be assigned to a higher ranked jobs. The second compatibility constraint, which is very important to our analysis, is the so-called rule of avoidance. Basically, it says a candidate cannot be matched to a job from his home province. There are, depending on the dynasty, there are different types of rule of avoidance also. For example, sometimes avoidance of family members is added, but for the sake of analysis, we will talk mostly about avoidance of home region. So these two compatibility constraints forms the constraint in our randomization problem. Now let me talk a bit about why randomization is desired in this moment. So here is a quote that we took from the records of court debates in Ming Dynasty between Emperor Chongzhen and his ministers. And when they are discussing about how to appoint the Grand Secretariat, which is a job that is the highest ranked job in the imperial government. So the Emperor Chongzhen said that finding the right man benefits greatly the empire, and I do not dare to make decisions by myself. Therefore, I ask heaven's will. So, so here, this kind of randomness represents this heaven's will. And to put it more concretely, in fact, the minister Sun Peiyang, so he was the minister he was the president of the Ministry of Civil Appointments or Ministry of Personnel at the time when the lots drawing procedure was introduced. And so this is a quote taken from his biography, and it says that he was only annoyed by the demands of powerful courtiers, and therefore he instituted the methods of drawing lots. Candidates were allowed to draw a lot in person, and it was forbidden to ask for replacement. At once, the selection of official enjoyed a considerable reputation for impartiality. So this is in a background that in the late 16th century, powerful political groups often could advance their own people for positions. And this significantly weakened the central power. So introduce randomness first of all can be seen as kind of fairness, impartiality, and second, it can help to diffuse all these different political power within the empire. Now let me describe how this lots drawing procedure works. There are several versions of it. For demonstration purpose, I will focus mainly on the version in early Qing dynasty. And compared to the original lots drawing procedure introduced in Ming, in the early Qing, partitioned assignments were introduced. What does this mean? This means basically for each type of jobs, for example, county magistrate, a set of candidates is predefined. So the set of candidates could consist 5 advanced scholar, 5 advanced scholar, and 5 recommended men, for example. And in Ming, essentially such partition was not used, and therefore it can be that rank compatibility is violated. So the early Qing procedure respect the rank compatibility. And then for given partitioned assignment, what we do is that we draw a candidate, then we draw a job. If the pair is compatible, in this case by rule of avoidance, then we announce the match and then remove the pair from the jars. If this pair, for example, is not compatible, so the person we draw is matched, selects a job from his home region, then we will put the job aside and keep drawing until a compatible job is found. And then we will announce the match and then remove the pairs from the arms and put back the incompatible jobs. So we repeat this drawing procedure until there are no unassigned jobs or candidates, or the unassigned jobs or candidates are incompatible. So this is the basic lots drawing procedure, or what we call the Chinese lots drawing procedure. Here is an example to, first of all, demonstrate how it works, and second of all, to address that there is an inefficiency problem that arises in the lots drawing procedure. So in the example here, I have 3 workers and 3 jobs. So each color represents a region. So worker 1 is from a red province, and worker 2 is from blue, and then worker 3 is from orange. And then on the job side, basically we have a job from the purple province, and then we have a job from the yellow provinces, and then we have a job from the red province where the worker 1 comes from. So it can happen that first of all, we randomly pick a candidate, and the first candidate we pick up was worker 2 from the blue region, and then we draw a job for him, and this job is purple job. And since it's from since the worker is from a different province other than the job, then they are compatible, so we can safely assign them. Similarly, we can assign the orange worker or candidate. So here I'm just following the jargon in the literature to call candidates worker. So so we can assign the orange worker to the yellow job. And here we can see obviously there is a problem with this assignment. That is, worker 1 is left with a red job, which he cannot be assigned to, right? So this is a very simple example illustrating that in the lots drawing procedure, such efficiency can happen. And in fact, we can match all of the workers in this example. Of course, to have a magnitude, we provide also a theoretical result that the upper bound of this inefficiency can go as high as 50%. In practice, this means for each of these unassigned candidates, they have to wait for 2 months for the basically for the next round of assignment. Right. So so one way, I think most of you probably have already noticed that one way to solve this problem is to prioritize the hard to match workers, right? So back into this simple example that I just gave, what does this mean is that actually we can put this hard to match worker 1 from the red region or red province in the first in the jar that will be picked first, right? So what we do is that we will ask him to pick the job first, since he's the difficult worker. So after assigning him, we will safely go on to assign the rest of workers. And in this example, we see that exactly we can assign all workers to all jobs, leaving no assigned jobs, right? So this is reaching what we call the maximum efficiency. And we know that in general, by prioritizing hard to match workers, we can match weekly more workers. And here is a historical evidence on, in fact, in history that they did this, right? So they prioritized hard to match workers in 1824. So what it was done is that those who have home province to avoid, they will draw first in this monthly appointment. And if they still draw a job that needs to be avoided, remove the job and ask the candidates to drop another job, right, until the compatible lot is drawn. Yes. So, of course, there are different solutions to this problem. Another possible solution is the exchange method. In fact, it has been discussed in 1602. So in late Ming Dynasty, right after the lot drawing procedure was introduced, what it says is basically that a candidate who either draws an incompatible job or ends up with no compatible job left was suggest to exchange their incompatible job with another candidate who is matched with a compatible job in a mutually accepted way, right? So back to our simple example, we have this red workers at the very beginning without prioritizing him, that he was not assigned. So what we could do is ask him to exchange the job with the blue worker who was assigned to the purple job in a way that they should agree, right? So there was a discussion on this method. However, there was no indication that such an exchange was actually carried out. And in fact, in one of the discussion, it was mentioned that it was very difficult to undo the matches that are already made. Therefore, we think that such kind of exchange, despite there is theoretical appealing, despite it's theoretically appealing, but it's less practical. It's less implementable in practice. Therefore, our solution will be mainly based on prioritizing workers, and the idea is that we figure out how to prioritize workers in advance, and if this is announced publicly and it seems it's more acceptable than exchange after the match has been made. However, there is a problem with this prioritizing method, is that in fact, prioritizing one side, in this case, just now I have shown that we have prioritized some difficult workers, and this is not sufficient to guarantee that we will always match as many workers as possible. So here is another counter example that illustrates this point. And in this case, we have 3 workers from 3 different regions represented by the color here. And on the job side, each worker, basically each job, so from the red province, we have a red job. And then from the blue province, we have a blue job. And from the orange province, there is orange job also. This means that for each of the job, there is a corresponding incompatible worker to start with, right? So by using just now the prioritizing the difficult worker, in this case, all of them is difficult or hard to match. So let's say we prioritize this red worker first, and then the blue worker, and then the orange worker. And then we see that we can end up in a situation where the red worker is matched to a blue job, and then the blue worker is matched to a red job. And then again, we have this orange worker left with the orange job, which is not compatible by rule of avoidance. Right, so to solve this problem, we introduce what we call the generalized lots drawing procedure. And this generalized lots drawing procedure is inspired by the original Chinese lots drawing procedure. So here is an illustration of how the generalized lots drawing procedure works. We have on one side the workers, and each brown box represents an urn that will put them in. And then on the job side, we also have a set of urns, and then in each of this brown box, we will put the jobs in, right? So for simplicity, now I just consider there is one worker, let's say, green, let's take one worker from the first box, right? And what we mean by the generalized lots drawing procedure is that we will ask them to draw jobs from the first urn, right? This red box, and they can only go to the second box after they checked all the jobs in the first box, and they are not compatible. And so only in this case they can go to the next urn, and so on, right? So in this case, it could be that the worker here from the first urn found a compatible job in the third urn, right? So, and then after we assign all the workers from the first urn, we go to the workers in the next urn, right? So we are following this kind of a sequential procedure for both, first of all, for jobs, and then for workers. So this is what we mean by the generalized lots drawing procedure. For the sake of time, I will not go into details of our theoretical results, but there are two main results that are helpful for our analysis later on. So the first one is that we show for every market, there exists an efficient sequence of urns. What do we mean by efficient sequence? First of all, the sequence of urns is basically the way we order urns here, right? So we have a sequence for the workers and we have a sequence for the jobs. And we show that basically there exists an efficient sequence, which means there exists an ordering of urns for both workers and jobs such that they can match as many workers to jobs as possible. And the second result says that in addition to finding this efficient sequence, that the sequence can also satisfy the equal treatment of equals, which is appealing fairness concept. This basically says that for workers, for example, within each urn, they face the same chances to be assigned to a certain type of jobs. The theoretical results basically tells us that we can use the generalized lots drawing procedure to solve this kind of a randomized constraint assignment problems in a simple and transparent way, right? By drawing lots from urns. However, there could be many different ways of organizing the urns. And in what follows, what we try to do is that we have two guiding rules in mind to design this efficient sequence of urns. So the first rule is that we try to have as small number of urns as possible, right? So this will help us to have a simple solution. And then the second guiding rule is that we try to have intuitive order and aggregation of types. So now I will try to provide a solution to the Chinese civil servants problem. Because we are searching for a simple solution, so we need to use some assumption. So here the assumption we are using is that we are saying a market is over-demanded if for all regions that have workers and jobs. So basically these are hard to match regions. There are weekly more workers than jobs, right? So the jobs are over-demanded. This might not, it's a assumption, but it might not be too strong, we think, because in fact, if we look at the number of candidates for each type of job, there are always more people demanding the jobs. because the supply of the jobs is quite limited. So here is an illustration of the solution to the Chinese civil servants problem. What we do here is that, first of all, we rank the candidates so we rank the province by the number of candidates they have, or the workers they have, right? So W1 here in the first urn is the province that has the largest number of candidates. So we put all these workers in the first urn. And then in the second urn, basically, we put all the rest of candidates from regions. And these candidates, W2, W3, they indicate that they still have, they are still hard to match jobs, and they still have to avoid certain jobs. And the W minus here are basically the easy to match candidates, workers or candidates, because they are essentially compatible with all types of jobs. And these are the candidates basically coming from a region where there are no jobs in the assignment. And on the job side, what we do is that we put the jobs from the region, and the region basically corresponds to this W1, right? So these are this is the region which has the largest number of workers or candidates, and we put all the jobs from this region at the very bottom. And in fact, the surprising result of the surprising part of our result is that we can group all the rest of the jobs in one jar and put them on top. And what we do is that we will first randomly pick a worker from the jar that contains contains workers coming from this region that has the largest number of workers, and then ask this candidate to draw a job from the first jar, right? So for sure, this candidate will find a compatible job in the first jar. We will only move to the second jar after we assigned all the workers in the first jar, right? And the way the candidates are drawn is that they will first have to draw all the jobs in the first jar, and then only after they have searched for each of the job in this first jar, they will go to the second jar. So by this, we can actually guarantee that we will match as many workers as possible. And the solution, in fact, only involves 2 urns on one side, and two urns on the side of workers, and 2 urns on the side of jobs. And it's pretty straightforward to organize the sequence. So in this example, I have shown that this is a solution to the Chinese problem. In the paper, we also try to look at other applications that I mentioned in the introduction, and this is it seems I still have some time that I can maybe talk about it. But first, maybe let me to summarize a bit what I have said so far. So I hope that I have convinced you that in many real-life constrained allocation problem, transparency and simplicity are very important to the design of a procedure. And drawing lots is simple, transparent, and historically robust procedure. However, as I have demonstrated earlier, that the original Chinese lots drawing procedure might have inefficiency problem, and therefore we introduced this generalized lots drawing procedure that can allow us to find maximum matching. So this gives us efficiency, and also that it can satisfy some fairness concept. And to put it a bit in the literature, so our work is mainly related to market design. and matching, or the design of matching market. So recently we have a few papers that I have listed here that they start to talk about design objectives that are beyond the traditional consideration, for example, transparency and simplicity. And in our paper, we didn't really try to show what is transparent and what is simplicity. Rather, we take transparency and simplicity as given, and we argue that the lots drawing procedure satisfy these two properties. And more generally, our paper is related to the literature on random assignment problems, in particular, random matching on the dichotomous preferences. And by dichotomous preferences, basically, it's similar to our case where you have one worker who is compatible or not compatible with the job. So it can be viewed kind of, in our case, although it's constraints, but you can view it as kind of preferences, the preferences from the job side. And then some other study, in particular in kidney exchange, they look at these incompatibility constraints. And this is mainly driven by blood type compatibility. And also that we have some recent papers on refugee assignment, where capacity constraint is a problem, because when you assign a family, a refugee family, a family might demand different units of beds, or let's say education resources, and the hosting family might have also constraint in providing these units. And then another related paper is a paper on the football groups matching. So this is, for instance, like in the FIFA grouping lottery draw, that in general, we will try to match one team from one group to the team from another group, subject to some constraints. What we argued, the main difference is that in the FIFA lottery drawing, it's in fact being assisted by computer algorithm. So each time when they draw a group, a computer algorithm will compute by looking ahead all the potential steps. What are the compatible team from another group to be drawn? And compared to this procedure, our procedure requires us to have an efficient sequence in advance. And once the match starts, we will not recompute what is compatible or what is not. So we argue that this is more transparent than using computer algorithm. And more generally, this is related to in the graph theory, the study about maximum matching algorithm and online matching algorithm. And again, as we argued, that our solution is more transparent and simple, because given our problem, what we could do is that we write down all the constraints and then found all the possible maximum matching, and then randomize over all the possible matching. So that could be a solution, but we think this will be hard to explain to people to start with. And second, it might be difficult to implement in many contexts, like maybe not, since the civil servants assignment was in the past, it's not possible to redo, but like in public housing or assignments by some local governments who have limited resource to computer algorithms, and having a simple having a simple method such as lots drawing would be easier than using a computer-based method. And more generally, our paper relates to market design in a historical context. And these are mainly papers use theoretical models to study the changes of institutions. So for example, Griff et al. Here, they studied the guilds that are formed in medieval Europe. And then also there is a paper on on the debt clearing market in pre-industry Europe, and also a theoretical study on how to select the Pope. So I think that's my talk. And thanks a lot for your listening. Since it's a work in progress, and so comments are very welcome. And I know it might be a bit different from the previous talks, but nevertheless, we're happy to hear your comments. Thank you.
Thank you, Li. Any questions from the audience?
I have a question. It seems like that you only you only want to match as much as possible, but you do not consider the quality of the match.
Right.
But in a typical job market, I think it is important to consider whether the work and jobs are a good match. And always we have some preference for some job, especially in your case, like all the people want a good job, so we want the most able person go to the go to the best job, right?
Right.
I'm not sure whether you can improve your algorithm to fit this new scenario.
As I said, it's a work in progress. So now we are actually, as an extension, we are considering indeed what you mentioned, that we try to look at, for example, which matchings could be more assortative, right? So that we match more higher ability candidates to higher rank jobs. Yes, so that's one thing that we're trying to do. So yeah, thanks for the comments. As for the preferences, so we try to ignore that part. The main reason is that as we understood, for not only in the Chinese context, that preferences are not so desirable actually. It was first introduced actually, so first they introduced the lots drawing procedure in Ming, and then they tried for a short period to experiment with preferences. And then in the end, they removed the part. The reason of the preferences is that people often prefer a job in the same region as where they come from. So again, this is not in line with the objective, right? To have more, to have less regional partition as a result of in fact, of preferences. And as we see that in Qing dynasty, that preferences was not used at all. And it seems from the discussions, the debates we checked between ministers, they don't even think this is a problem anymore because people accept it as it is. And another example that I could give is that we look at the refugee matching. It seems also it's a place where preferences again is less desired. Of course, on one hand, you could say that if I was going to be assigned to a place where I like, I might have better labor outcome, etc. But on the other hand, I think it's a bit not clear that while having too many people from the same region, is it good or not? So some degree of randomization is preferred in this case. That's why we try to stay away from preferences in our modeling. That's the main reason. Yeah.
Okay, thanks so much.
Yeah, thank you.
Yeah, I have a question which is related to Xianqiang's question. So in your study, you focus on the efficiency of the assignment, right? So is it possible that you can analyze the welfare of the assignment or the random assignment, right?
Yes. Yeah, thanks for your question and suggestion. So I think that's an excellent direction for empirical study to, if I understand correctly, right, to have an idea about the welfare consequences of this random assignment. But for the moment, we are not doing it, mainly for guess, data availability reason.
Okay, thank you. I think it's time for taking group photo. So everyone in the virtual conference, could you open up your camera and we can take a group photo? Okay, thank you. And I think let's have dinner or lunch, then we'll come back at 7 o'clock.
I guess so I was thinking about these breakout rooms, but it seems that people want to kind of have dinner and stuff, Klaus. So
the point is, I think this was not fairly communicated now, because I think everybody's gone now. Yes, isn't what it is?
yeah, it seems like it.
Yeah, the idea would have been to bring some food, and so I do not see. I guess we are probably the only one now left here. Yes.
Seems like it. Yeah.
Then we should maybe just ad hoc decide to just skip it. Yes, I mean.
Yeah, I know, absolutely. Yeah. Okay, so I'm going to be away for the first part of the next session.
Okay.
Until like 11 to for about 45-50 minutes.
So is Corrado aware how to start things? I mean, I will be around. It's not a problem, but
yeah. So I think everything stays on in a way. So everybody.
Yeah, in a way, exactly. So
yeah.
if I come back in a few minutes, I can just open up and say hi, please.
Yeah,
please
exactly.
yourself.
So I just leave my screen like this, so I'm not turning off.
Yeah. So Corrado will. I don't think he's here at the moment, so he cannot. Yeah. So he will know to chair. Yes. I mean.
Yeah, I assume he knows that he's chairing the next session. I mean, I can start off. I can come back at 11 when the things start, and then I can leave like 2 minutes after that, just to make sure. Yeah.
Okay, just to make clear that it has started in case something.
We'll have a go, and I'm sure a few will join just in the next few minutes. So because there are 3 papers, so I'm mindful about time. Also, it's going to be a bit late soon in China, so maybe we can crack on with your paper, which is on the effects of a rural educational program, and then we'll see how it goes. I'm sure there will be questions, so if you can keep your presentation at about half an hour, and then we leave a little bit of sort of a few minutes at the end for questions. If someone has burning questions, you can put it on the timeline on the chat, and then I'll be happy to moderate them and pass them on. If not, we'll postpone them all after Yi Chen talk. Floor is yours.
Okay. Hello, everyone. It is my great honor to be invited to give a talk to our still incomplete work. So any suggestion would be highly welcome. So as you can see the title, so the title is on the massive effect of a massive rural education expansion in China. Before I show what we did, I think it is interesting to show a little bit of motivation. So first of all, if we look back to the time of the year 1978, we know back then China is very poor. You can see its per capita GDP is only about 1/20th of the world average. But another often overlooked fact is if you look at the human capital level back then, China, in terms of the secondary school enrollment or life expectancy at birth, you can see China is even slightly exceeds the world average. So if we plot a graph, so the x-axis would be the logarithm of GDP per capita, and the y-axis would be the secondary school enrollment rate. You can see China is a very clear outlier here. Its achievement in education way exceeds its corresponding level of economic development. Similar pattern for the life expectancy. So actually, two Nobel laureates, they already highlighted this fact by claiming this human capital accumulations before 1978, which has been generally regarded as the starting of Chinese economic miracle. So Heckman says that China's rapid growth was fueled by substantial physical capital investment applied to a large stock of medium-scale labor accumulation before economic reform begins. Similarly, Ahmad Dissens argued that the magic of China's market rests on the solid foundations of social changes that happened earlier. So therefore, there has been two questions. The first here, we are trying to answer one question. So where did this China's pre-reform human capital come from? Another question is, what's the effect of this pre-reform human capital about the China's economic miracle? So we will leave it to the future. So for today, we are trying to understand the questions. So why China make this economic education achievement before 1978? So previously, I had the four of us write one paper about the send-down movement, so which partially answers the question. So the story is that during the Cultural Revolutions, so Chinese government mandated a large population of uneducated youth to the rural villages. So this is definitely a disaster for the urban youth. But if you stand from the perspective of rural villagers, this is for the first time that the rural villagers received a large pool of uneducated youth. And many of them actually became teachers, and they helped to improve education achievement in rural China. And this paper has the luck to be published in American Economic Review. So at the same time, there's another important event happened around this send-down movement, which is if we look at the time series of China's number of secondary schools, you can see a marvelous increase about 10 times. So this is the year of 1965, 1965. Here is 1977. You can see we witness a very rapid increase, probably the largest increase in human history in the secondary education. So in this paper, we're trying to understand the consequences of this rapid education expansion. So what do we do? So first of all, we go to the county level data. We collect the number of secondary schools in each county. And therefore, using this so-called cohort difference in differences, we try to understand this effect of massive education expansion program on a list of factors. So first of all, we are going to look at the quantity of education, say whether someone received education or secondary education. So another important question is because the expansion takes place at such rapid paces, therefore one initial question is, can China maintain its quality of education at these paces? So we are going to show you some evidence that this expansion of the quantity of education does lead to deteriorations in quality of education. Nevertheless, we still see some evidence that this rapid education expansion contribute to the development of rural villages. We will show you some evidence, albeit we do see the deterioration in education quality. So our study contributed to 3 strands of literature. So first of all, we contribute to the understanding where does China's pre-reform human capital comes from and it complements our previous study. And another thing is we help to understand through how to improve the supply of education in developing countries. So a very classic paper is Duflo's 2001, which is on the massive education school constructions in Indonesia. So here we are doing a Chinese version, which is probably the speed of construction is even more rapid in China. So what's very interesting is here we're not only emphasizing on the quantity of education, but also quality. So therefore, our research is particularly relevant to Adland as 2003. So in this paper, they studied expansions in Pakistan. So what's interesting is he see a success in urban China, but a failure, a success in urban areas, but a failure in rural areas. And they attribute to difference because in the urban Pakistan, they have the resources to maintain this expansion. So in our study, you will see a similar pattern. So a little bit about the background before the education system of China before 1978. So during that time, the Chinese education system can be categorized into like 2 ideologies. So the first is so-called socialist egalitarian model. So basically, it is like the goal of the government to be popularize educations and reduce class differences. So no matter you are coming from rich families or poor families, you should get some educations. So this is a contrast in a typical education, which is called competitive model. So the current education system in China is closer to this model. So they emphasize competitions and they emphasize on producing experts. So before the Cultural Revolutions, so the strategy in China is work on 2 legs. What are the 2 legs? So for the popularizations, they aim at rural China, at rural villages. So they set many Minban elementary schools so that they try to popularize primary level of educations. But certainly the quality of educations back then in rural China is poor. So it is the responsibility of urban schools in China to pursue quality. So you have the key concept of key point school. So you know now every Chinese parent is crazy to get their schools, get their children into the key point schools. So what happened after the Cultural Revolutions? So during the Cultural Revolutions, so the Chinese saw the Mao, he deliberately destroyed the old elite education system, and then he tried to construct a new massive education system. So what is known is, so they tried to abolish key school. They shortened the curriculum from 6 years of primary school, 3 years of junior high, and 3 years of senior high to 5-2 system. And the college entrance exam was suspended for 11 years, and the getting into college was replaced by recommendations. So another important thing that is not have been well studied before is that during this time period, we have this massive construction program in rural China. So the goal of this expansion was to achieve universal secondary educations in a short period. Then after the Mao's decease in 1977, then there's a big reversal of the policy. That is why you see a big decline in the number of secondary schools after 1973, because there is a reversal of the policy after that. So how did China manage to achieve this massive rural education school? So the goal is, as our title says, so roughly the goal is to establish at least 1 secondary school in every people's commune. So therefore, several villagers would put their resources together to build a middle school. However, whilst it is maybe easier to build a school, I will show you a photo later because the school here is very simple. So it is not the concept of middle school in modern China. It is very simple. But the main challenge is the teachers. So if you expand the number of schools by 10 times in a short period, so a lack of teachers will certainly be an obstacle. So for example, so the government asked some teachers in urban China to go back to their villages of their origins. They will also hire locally some relatively educated rural youth to become the main band teachers. And interestingly, so the arrival of Sinan youth from the urban China, because they are relatively educated, so they become a very natural candidate for the teachers. And another important thing is actually there has been a long debate about whether education can help rural development, because there is a controversial stuff. So imagine if a rural kid, he is very talented and he gets very good educations. So what would he do? He will get educations and he will leave the rural villages and he will move to urban villages. This is why before developing educations has been viewed as not so effective in developing rural areas. But during the Cultural Revolutions, so this channel is cut. So even if you get good education, you cannot move out of the villages because of the better educations. So therefore, this movement, another unintended consequences is it manages to keep talents on rural lands. Another thing is, so the course taught during the Cultural Revolutions also slightly changes. Although some people view this as a deterioration in education quality, but this is actually not 100% true, because the design of the courses is more practical oriented. So for example, in rural China, they taught courses like agricultural knowledge and industrial knowledge, which can be directly applied to the agricultural production. That is, later we will show that this expansion program actually greatly helps the rural agricultural productions in rural China. So here is Fogang in the 1960s. So you can see this would be called a school back in the 1960s. So in 40 years later, then this will be the typical middle school in our mind. My point here is it's relatively easy to build the schools back then. The difficulty would be hiring teachers. So I'll introduce a little bit about the data. So the data is called local gazetteers. So you can view it as a historical document about the history in each county. The key information that we collect here is annual increases in secondary school from 1965 to 1977. And because here we are focusing on the relatively less developed areas, so therefore we purposely drop more developed regions, including Beijing, Tianjin, Shanghai, and Shijiaqi, which is the city government district. So in short, those are the relatively developed county level units in China. So finally, we have about 1,000 counties, and we collect other information for our robustness purpose. And this would be the map we see, and you can see different counties, they have different expansion speed. And you did not see a very clear patterns about the correlations in this graph. And we also collect data from the populations, because if for the people of the same cohort, then if they live in different counties, then different counties would have different expansion speed. Similarly, in the same speed, if you belong to different cohort, you will be exposed differently to this expansion program. And in our data, this will be the speed of the educated expansion you can see in our data. Similarly, a very rapid increases. And if you look at our cohort, you can see, so during the cohort, you have a very rapid increase in the number of junior high graduations and also senior high graduation. And afterwards, you see a rapid decline. Very similar to the general statistics we observe at the national level statistics. This will be our identification. So our key identification would be a cohort difference in differences. So we have two layers of differences. So the first differences is this school construction rate. So basically, different counties, they build their schools at different speeds, some faster, some slower. And the second difference would be the treatment status. And it is easy to imagine that if you join the junior high school at this point, then you are much more likely to enroll in the lower level secondary educations compared to when you are here. And we can see this process is roughly linear. Therefore, we have this linear treatment. If you belongs to this cohort, if you enter junior high school at this point, then you are fully treated. And if you're at this point, then you are not treated. And during this point, the treatment status grows about linearly. And then this becomes our core differentiative strategy. And then we control a very complex form trying to control for cohort trend, because this is the central threat to the heterogeneous trend is a central threat to the cohort DID strategy. We include cohort by promise dummies, and then we try to interact with county characteristics with a non-linear cohort trend. About the applications. So because we are using a cohort DID strategy, so we don't require this construct rate to be random. Instead, the key assumptions is the parallel trend assumptions. So of course, we cannot test it because this is something that we cannot be tested. But we are going to show some evidence supporting this parallel trend assumption. So first of all, we will show that we already incorporate a very complex form of control of possible heterogeneous trend. And in the next slides, if we break the cohort into a set of dummies, then you can see if before the treatment, you can see extraction around 0 and it's statistically insignificant. And when they become treated, you can see the effect grows about linearly. And when the expansion ended, it started to decline. And a similar pattern for the senior high school. And we are doing a very wide range of compounding factors, including other events that may happen at the same period. And due to the time constraint, I'm not going to talk too much about this. Now let's go at what's the effect of this expansion program. So first of all, about the quantity of education. So unsurprisingly, most of them are positively significant, and the effect is most strong on the junior high school. It's not surprising because this is the school that was built most during this time period. Although the effect seems to be relatively small, which is only about 0.1 years, but here I have to remind that this is a severely underestimated result because those two measures, both the school construction rate and the treatment cost status, they are severely measured with error, which would bias our estimate towards 0. So therefore, what we provide here is a very lower bound of estimations. So this is, I think this is a very reasonable estimate, and this is not surprising at all. And we see some heterogeneity when we look at the less educated group. For example, if you look at the effect on less educated counties, you will see the effect will be larger, and the effect would be larger on the female sample. So generally speaking, the effect of school constructions would be stronger for the less developed group. So what's interesting here? Here we have this quality trade-off for education and expansions. So here you might be wondering, so what would happen? So how people maintain educations at this speed of expansions? So to begin with, we can replace the Y outcomes from education to a set of labor market performance. So you can see the effect is not significant, which means although the expansions improved their educations, it did not improve their labor market performance. And if we control for educations, which means if you find a junior high graduate before and after the expansions, you will find someone getting educations after the expansions, he would perform worse in the labor market. So we view this as evidence that the education quality during this time period gets worse if it expands too rapidly. So why is there a deterioration in education quality? So one very simple example is now there's a lot more students enrolled in the schools. Before the expansions, only the very talented people, they would go into the junior high school. Now a lot more people would be enrolled in the school. Of course, if a county it doesn't have enough number of teachers, then it will be harder for them to maintain quality. So in this case, we make two hypotheses. So first of all, if a county can barely maintain its number of schools during the expansions, then after expansions, after the program ended, what would that county do? That county would try to cut those schools as soon as possible. Instead, if for some counties that can comfortably maintain those schools, even after the expansion ended, then we can view the education's quality during this time period would be better. And another thing is, as I mentioned before, the arrival of send-down youth, it becomes a natural candidate for the availability of teachers during the expansion period. So here there is some evidence. So if we plot the correlations of send-down youth between the increase in secondary schools, you can see there is almost no correlations. Actually means send-down youth does not contribute to building more schools during this time period. But we see very strong correlations for teachers. So therefore, we have this very nice settings that send-down youth are only correlated with teachers, but not schools. Therefore, we can introduce this like triple difference by interacting, additionally interacting with the post-expansion school drop ratio and the local density of send-down youth. So although there's not many stats here, but generally it's consistent with our evidence. So if a county is going to drop its schools rapidly after the expansions, then the coefficient would be negative. And then we found some evidence supporting that if a locality it has more send-down youth, then the effect will also be more positive. And lastly, we are going to look at the effect on the rural development. So why this education expansions it can affect the rural development? This is largely because the materials taught during the expansion period is very relevant for agricultural productions. For example, some anecdotal evidence suggests that what they were taught tractor operations and repair. And for example, and they would be taught medicine, and they actually become the first group of barefoot doctors in rural China. And they also survey that you can see they learn how to operate and repair engines, and they tell how to import agricultural skills. Now you can see the education here, although it's not the typical educations like chemistry, like physics, they are more directly related to the agricultural productions in rural China back then. Therefore, we collect other sets of county-level data back then, including the number of barefoot doctors, also collect numbers on the grain productions, and then we collect from Chen Shuo and National Huan's papers on the tractors. And then we use these equations to estimate what's the effect of the expansions for those outcomes. Now, as you can see, for barefoot doctors, compared to the numbers before 1965, we can see the effect is generally positive. But after the collapse of people's commune, which is basically breaks the system of rural medical system, we can see a decline. But during this time period, we do see a positive correlations between barefoot doctors and the school constructions. And similarly, you can see after the number of graduates enter the labor force, you can see a gradually increase in the effect on the grain output. And then we see the effect on small tractors and other placebo. We didn't see such effect on large tractors because according to Chen Shuo and National Huan's argument, in China back then, large tractors is not a very efficient way for China because now each house is responsible for cropping their own land. Therefore, to conclude, we estimate this. Therefore, we highlight this fact that China built about 108,000 secondary schools in a very short period. And we try to understand this effect, and we try to understand the effect on education quality, and rural development. So I think that's all. Maybe I'm too fast. So if is there anything that is not clear, then you can answer any questions. If you
Thank you, Yichen. Thank you. The presentation was very clear. Thank you very much. If there are questions from the audience, you can just feel free to chip in, or you can write them on the chat. Are there any questions for Yichen? Okay, maybe I'll start with one.
Hi.
So, oh, sorry, someone. Yes, please.
Hi, Yi. So I'm pretty confused by your empirical results. So before you showed us an insignificant impact of the expansion of middle schools on non-agricultural employment, right? Then later on, you showed us the significant impact of the expansion on the barefoot doctors or small tractors.
Okay, I see your point. Yes, that's a very good point. Actually, I didn't figure out there is a controversial here. So we try to understand why we didn't see something significant. So first of all, if you look at the data, then one possibility to account for why we didn't see the significance is because actually for rural China, if you look at the data, more than 19% would be farmers. So the share is actually very small if we look at the census data. The reason matter why we are able to declare the numbers because we specifically collect the data on barefoot doctors. So one possibility, another thing here is, okay, I see. I have a better answer here. So what is we actually comparing here is because here we are using the 1990 censuses. So therefore, we are looking at in 1990 cross-sectionally, whether people who experience an expansion, they had higher occupations. And if you look at the barefoot doctors, you can see you have had this reverse U shape because due to the collapse of people's commune, the barefoot doctors almost disappears in the 1980s. Therefore, we cannot detect it in using the 1990 censuses. And maybe it's worthwhile for us to look at the data, like say 1982, to say whether we can see an effect using the 1982 censuses. I see. Thank you.
Very good. Yeah, I had a similar question, and I think the fact that you're probably seeing a lot of these reverse in this pattern has, especially after the 80s, has to do obviously with the large development that are happening in China and potentially the large wave of migrations. Because when you look at, obviously at the census 1990, that's already a time where, you know, there was a huge wave of migrants out of rural areas. So, I mean, so there's a bit of that confounding factor. But my real question from before was, so are you implying here that the reform targeting both infrastructures and teachers, if you want, had somewhat very short-term effects? And what, I mean, what's the lessons that we learned there? I mean, because, right, think about China now, right, and think about the idea of potentially reinforcing the investment of education in, you know, in less developed areas. What do we learn from your study here that can be lessons that can be learned today? How should the government target educational investments today?
So this, I think I can view this question as what is the takeaways from this study. So I think there are two takeaways. So the first of all, I think this event itself is very important because it hasn't been discussed before. So not people actually know before China has experienced this speed of education expansions before the 1978. So I think highlighting this event itself, it could be one important takeaway for this study. And the second takeaway would be here we are highlighting the interactions of bricks versus brain. Now here you see if you only in building schools, say this would be the bricks. Then even if you build it very fast, then it will be very hard to maintain the education quality. And only if you have both an improvement in the bricks and the brains. So here the brains refers to teachers. Then you have this interaction effect that would improve the quality of you can improve the education without deteriorating in the education quality.
Okay, thank you.
Chen-Yi, I have some questions. First is that you use 2005 census. We all know that the income from that census might be problematic, right? So yeah. I'm not sure whether your results, whether we can trust your result actually. And second, the interpretation for your income result is that you believe it is a proxy for your quality, education quality. But what if, but during that time, actual migration is restricted. Even if they get better education, they have to stay at their hometown to find a job. But under that case, if we think about the GLO curriculum, even if they get a better job, they cannot, no, even if they get better education, but because the job supply actually is restricted, is constrained, then actually they cannot find a job with higher wage. That's my question. But I mean, that is not a proxy for education. Still, they can get a better education without better labor market outcome.
So thank you, Xianqiang. Actually, you raised many important points. So the first is about migration. So if you look at the migrations in China, it actually started in, I think it is in the middle 1990s. So which means one advantage of using 1990 census would be the Chinese Great Migration has not started in 1990. So that will be an advantage of using this wave of censuses. Of course, the reason of using the 2005 and the censuses is that we have no choice. So you might know that the 2005 census is the only wave of census that contains this income data. We have no better choices. For all other censuses, we can only have access to the occupation. And the thing
is that possible for you to use the CFPS to reconduct your analysis?
No, I'm afraid no, because here we really need a very large number of counties to get our results. Here you can see our counties has over 1,000. But for CFPS, I think the number is only about 160, and we have tried. It even cannot give the first stage. The number of counties is too small.
Mm-hmm. And what about the GLO curriculum issue? That I still believe maybe their education is, they get better education, but because restriction of migration, that's why they cannot get higher income. But here your interpretation that.
That actually belongs to our explanations of why we don't see labor market outcomes during this time period, because by constructions, there would be very limited non-agricultural opportunities. So in the dream case, if this number is 100%, then by construction, we won't be able to see anything. So actually, so we are thinking this might be one possibility that we did not have significance here. But here, I think it will be interesting to compare to our previous paper on standard use. So in that paper, if we this variable suit to standard use, then you can see we still detect a significant result on occupations. But for school expansions, we didn't see this effect, which means at least if compared to the standard use, we find standard use, it improved both quantity and quality of educations. But using the same specifications, we don't detect the effect on the quality of education.
So basically, if you run a regression like return to education, you will find no result.
Yeah.
I mean, use your program as IV for education and you do the regression return to education. But in previous study, you will find that return to education actually is significantly and positive.
But in this setting, I think they don't is suitable for estimating return to education because the exclusive restriction is not possible to hold. As you can see here, it affects both the quantity of educations and the quality of educations. And therefore, the estimate it cannot be directly interpreted.
Okay. Okay. Thank you.
Thank you. Are there more questions for Yi-Chen? Actually, because there's still a couple of minutes, Yi-Chen, I wanted to ask, have you thought to, I'm still puzzled about this, sort of effect being so malleable and in the, this sort of reverse pattern. Have you thought to think about more long-term effects and looking how, let's say those, let's call positive education shock, if anything, has been transmitted intergenerationally. So if you look at the cohort effect, if you look at the cohort, I don't know, 20 years later, what is going to happen to the children of these affected parents? And I don't know if you have a way. I wasn't sure, you covered this. Thank you.
Yes, actually in our, we have this plan. So actually in our other paper on standard use, we have this 2010 censuses, which this group would have the offspring. In that case, we estimated the effect of the first generations on the second generations. So we didn't have the time for this project yet, but this is our schedule. Thank you.
Okay, very good. So if there are no other questions, I would probably like to thank Yi-Chen for his presentation and ask you, Yi-Chen, if you can stop sharing your screen. And I would like to introduce now Shuai Chu, who is going to present a paper on parental gender stereotype and student well-being in China, joined with Klaus Zimmermann and Shanchang Zhang. Thank you.
Okay. Can you hear me and see the presentation?
We can hear you and we can see the screen. Thank you.
Okay. Thanks to the host. And it's my great honor to be here, introduce our research. And today my presentation is parental gender stereotypes and student well-being in China. This paper is cooperated with Professor Zeng and Professor Zimmermann. Okay, firstly, I would like to show in the overview of this presentation. The part 1, I will introduce the motivation, and in part 2, I will introduce the finding and the conclusion. In part 3, I will show our data, and in part 4, I will show the model specification and the regression result. In the end is the conclusion. Okay, firstly, I want to introduce the motivation. Like this as in 2003, standard economics turns to be ignore what appeared to be important cycle cost of recessions. This view is based more on macro dimension, but we can still feel it strongly that cycle costs are part of economic analysis that cannot be ignored. So as an important indicator of cycle cost, subjective well-being, its influencing factors need to be paid attention to. We are very curious as to what the role of gender, the most obvious label that distinguish an individual plays in this. And through the literature review, we found that whether subjective well-being is affected by gender is debatable, and provides findings in the literature have been inconclusive. Studies found strong or lower effect for females, or even no differences when properly controlled for relevant other factors. So there is a long-standing debate on whether the gender gap in subjective well-being from the genetic difference as operated to a cultural and social context. There are many related studies from different disciplines, such as brain science and genetics. And recently, some literature has shown that the gender difference does not mean the genetic difference, and that the social context has a great influence. And also recently, however, a large number of economic literature has revealed that the relevance of identity, attitude, norms, and stereotypes is an important source of gender difference in subjective well-being and labor market performance, such as Agloff and Cronton in 2000, which propose identity economics as a representative theory. But identity, especially gender identity, is a difficult variable to measure. However, stereotypes, on the other hand, are relatively easily to measure. So through the literature review, we found that gender stereotypes may cause gender difference in subjective well-being when the generated pressed lead men and women to actually feel and express their emotion differently. And further, we wonder that factors. We wonder what factors will affect or change a person's gender attitude or gender stereotypes. And there is a paper showing that education seems to shape the way how more alligator gender role attitude and behaviors are developing. So based on about motivation, we want to examine whether parental stereotypes and education have an impact on the well-being of gender diverse of children. So I will briefly introduce our finding. Using the largest national education survey in China, which survey is the China Education Panel Survey, we also call this is CEPS. We found that parental gender stereotypes are not gender specific for student well-being, as well as gender difference are irrelevant in gender. They indeed show a strong or lower student well-being. And why did this result happening? We argue that parental stereotypes could undermine good self-confidence and make them more prone to anxiety and other mental health issues. For boys, strong stereotypes may indicate high expectation and pressures, which also generated negative emotions. And we will explain the result in the more detail later. Also, we found that parental human capital has no association with offspring well-being. Okay, and then I want to highlight our contributions. Our contribution to above debate, which debate is whether subjective well-being is affected by gender, is to focus on the intergenerational association that parental gender stereotypes may show for the subjective well-being of their children, and how this transfer is associated to parental education. Okay, in this part, I would like to introduce our data. The data from the CEPS, like I briefly introduced before, and we use the CEPS 2040. This survey covers middle schools from the 29 countries and the city districts using a stratified simple design. And this data, CEPS, is widely used in the study of labor economics, education economics, and children development, and the question of children development. Through sampling, we showing the data were collected in 2 samples, the mother sample and the father sample. In mother sample, we have a 5,300 students, and in father sample, we have about 5,000 students. We can find that from the simple count, it is balanced. And totally, we have over 10,000 students, among them about 5,400 girls. And we also see that from the girls and boys, the sample is also balanced. And finally, in the sample, students covered are 11 to 18 years old, which is because that I say before, the survey covers the middle school student. And then I want to introduce the dependent variable is a student subjective well-being, how to build. In the CEPS, the student in CEPS, we have an independent student questionnaire, and in this student questionnaires, student need to report the following feelings, which include depressed, feeling blue, unhappy, not enjoying life, and sad in the last 7 days in the range from 1 to 5, and 1 equals never, 2 equals seldom, 3 equals sometimes, 4 equals often, and 5 equals always. Which means that, for example, if a student she or he never feel depressed in the last 7 days, then he will get a score of 1. If the student he or she always feel depressed in the last 7 days, he will get a score of 5. So this means that the larger the value, the lower the student well-being. And a detailed analysis is provided in Table 1. In Table 1, we show the descriptive statistics of student well-being. We can see that we distinguish the sample of 2 groups, which the one group is mother sample and another group is father sample. In column 1 to column 6, the numbers indicate the mean of variables, and the numbers in parentheses indicate the standard deviation of variables. In column 7 to column 9, numbers are difference of variables between both parents, which means father sample and mother samples, and the numbers in parentheses are T statistics. We can see that the student well-being score is clustered around 2, which means they seldom feel depressed or blue or unhappy, blah blah. And girls in both sample have mostly smaller mean than boys, but the difference are very similar, but are very small. Table 1 also reveals that the mother and the father sample do not differ according to the provided difference test, which means that our data is balanced. Okay. After the dependent variable, I want to say the 2 key variables we focus about investigating on are parental gender stereotypes and parental education, and we also controlling for a large number of students and parental characteristics. Firstly, I want to show the define of parental gender stereotypes. In the CEPS, we also have independent parental questionnaires. In the parental questionnaires, the parent father or student father or student's mother contain response on: do you think boys are better at learning mathematics than girls? 1 equals yes, 0 equals no. And we treat yes as parental gender stereotypes. This measure of stereotypes has been adopted by most of the literature. So we believe this measure is reasonable and credible. Further, we use years of schooling to measure education of either the father or the mother according to the following rules. 0 equals no student, 6 equals primary school, and 9 equals middle school, and 12 equals high school, 50 equals college, 60 equals undergraduate, and 19 equals graduate. And table 2, we show the descriptive statistics for independent variable and control variables. Dependent variable I introduced before is we focus is parent stereotypes and parent years of schooling. And controlling variable, we include that parent age, parent hukou, his parent health, and parent occupation. And also we include the individual student characteristic, which include whether student is a girl and student academic ranking in the primary school, and student hukou and student age, and whether student attend kindergarten, and student age when starting primary school, and the student family's financial situation. Due to the time limitations, I will not explain on the detail of each variables. In this table, I want to highlight the result of the statistics of stereotypes and years of schooling for the sample. The parental gender stereotypes are somewhat but not markedly different between the mothers and fathers. We can see that in mother sample, we have 25.6% of the mothers and only 24.3% of the fathers have a stereotypes. This difference disappears if the student is a boy. We can see that in the boy sample, which suffer the stereotypes is 27.8%, and in the father sample, the boy suffers the mean of stereotypes is 26.5%, but it is more marked if children is a girl. We can see that in mother sample, girl suffer the mean of stereotypes of this mother is 24.8%, and they suffer the father sample is about 20%. So the stereotypes is more present among parents with a male child than with a female child. It is also more present among mothers with a girl than among fathers with a girl. However, the difference between the mother and the father sample are small. And another result is, I want to highlight is years of schooling of parents and years of schooling of parents. Year schooling is available with both parent and father both parent sample, which include mother sample and father sample, and can be compromised for consistently. In the mother sample, mother has 10.1 years of schooling, and the father has 10.4 years of schooling. In the father sample, the mother has 8.7 years of schooling, and the father has 10 years of schooling. The schooling levels appear to be only marginal different for children gender within the 4 parental groups. So it's the descriptive statistics of independent variable and control variables. And in this part, I will briefly introduce our model specification. Our model specification is the equal one. In the equal one, Y denote the student well-being, which include depressed, feeling blue, unhappy, not enjoying life, and sad. M and G are dummy variables, where M stand for mother sample and G for girl sample. S are the parent gender stereotypes, either mother or father where available. EM and EF are mother and father's years of schooling. X are the other parental characteristics, and Z are other student characteristics. And in table 3, we show the regression result. Firstly, I want to introduce this result. From mother girl and interaction of mother and girl. Result for this, we can see that the parameter estimate for mother girl and interaction of mother are all insignificant with expectation of interaction of mother and girl for sad. Which means implying no overall average difference between the mother and father sample, and with respect to gender difference among the students, and to the stereotypes, we find a very interesting thing that. We found a very interesting thing that in principle, the effect could be gender difference among a child and for both parents, which it is very obviously that a lot of literature says mother's education or mother's behavior will influence their daughters more, and father's behavior or the father's behavior will influence their sons more. And if parent has these stereotypes, which may be more huge influence of girls, because if parent has these stereotypes, they believe to female, and if the doctors feel that, which may be give her a huge hit. But our finding is very surprised, and is very interesting that there is only one parental stereotypes effect that disapprove all 5 well-being measures in a similar range from strangers for unhappy, feeling blue, depressed, not enjoying life, and the smallest side. In general, there is no parental difference for student gender difference. In this result, which means that if your parents have for a student, if your parents have a stereotypes, it doesn't matter your father have or your mother have. It's all will decrease your well-being. And if your parents have stereotypes, will all decrease student well-being, no matter the student is a girl or student is a boy. Okay, it's the finding of stereotypes, and then I want to introduce the finding of parent education, which also the parent human capital's influence. We found that education of both parents include father's education and mother's education have no impact on children's well-being. It is a very robust finding, and even if we interact as father's education of mother and father's education of girl, and also father's education interaction of father's education and mother and girl, we also find it is insignificant of these variables to student well-beings. So which may indicate that relative to parent education or parent human capitals, parent stereotypes have a more important role to student well-being. And if your parent student have a stereotypes, it will both decrease the student well-being. And finally, I want to do a briefly conclusion, which is we're using the largest sample for 2040 for the CEPS. Our study investigates the intergenerational association between parental education and gender stereotypes for subjective well-being of the 11 to 18 years old student. And subjective well-being measures collected on a 5-level intention score cover the well-defined items: depressed, feeling blue, unhappy, not enjoying life, and sad. And we found that parental gender stereotypes are showing to strongly decrease student well-being in China, but with no relevant gender difference between parent and student. And also parental human capital has no stabilizing effect for offspring well-being. Okay, that's all.
Very good, Shui. Thank you for your presentation. It was very clear, and I'm sure there will be some questions from the audience.
Okay.
Maybe I'll start with one. So if you look at, I think you cited some of those models that look at, at stereotype, but look also at the impact of, vertical versus horizontal transmissions of values. There's something puzzling me here, which it's not going to probably change the result, but might speak a little bit about channels. So 2 arguments here. First, it's quite likely that those stereotypes are very sticky across generations, which means if parents have a certain stereotype, also their children were going to have, or the majority of their children. So there's going to be mobility out of that, right? But it's going to be really sticky, strong persistence, yeah? So part of the result that you are capturing here, yes, it's the stereotype of the parents, but probably is also the stereotype of the children, right? I guess. So I don't know whether there could be a way to disentangle that, but I think it's potentially a channel for you, or something that that you might want to explore, because I think the interesting bit would be to disentangle these dynamics. How much are the next generation moving out from this stereotype. The second, which I don't know if you're lucky enough with this data, but if the kids in 2014 are, I don't know, between, in the 8 to 15 years old or something like that, wouldn't you have the ability to disentangle whether the cohort of parents are born, before or after the one-child policy? Because basically stereotype must have changed a lot during those times, male preferences and so on. And I know, the one-child policy law wasn't uniformly distributed in the country. Maybe it was stronger in rural area, in urban areas. So, but is there a way you can look at that in a sort of more dynamic aspect, in a sort of, because I think that was a big cultural shock. And maybe part of what we're seeing today is just also an average. I mean, what you're capturing here is an average effect, and maybe there is something we can learn on how those big cultural shocks actually influence stereotype. Thank you.
Okay. I will give you a briefly response. For the question 1, actually we did some we did some tests that parents' gender stereotypes it will indeed to translate their children's, and the questionnaires ask their parents stereotypes, and which also in the student questionnaire, students also answer this question, which is, do you feel male are better mathematics than female? And they also answer this question. So so the question 1, I think is important, and we can test it. In question 2, you says one-child policy. It's also very important policy in China, and which may which may influence many factors. Actually, in our data, we also could distinguish the girl, the boy, whether influenced by the one-child policy. And maybe the well-being will different if the children influenced by the one policy child. Yes, we can test it, and in our data, we also ask the student that whether you have a brother or whether you have a sister, and like this question. So yes, it's a very good comment. I will try later.
Thank you. I think
Corrado, if I
yes.
may just also say very good points. One has to understand that this is part of a more general project where we look at these intergenerational aspects, but we were so much impressed by this very clear and simple result we get for well-being, which is kind of a side issue in that project. Yes, that's why we thought we should put this in one place at this very moment. I mean, in particular, these intergenerational effects are very, very important, very interesting, because there is the data actually, as you suggest. Yes, so thank you very much for both comments, I think, which will be relevant for the project. Thanks.
Welcome. I think I have a question on the chat, I think. Let me just check. Yes, we have a question asking on how do you define the father sample and the mother sample? So what is there a particular question that defines the two different samples? Who is the respondent?
Yes, in the parental questionnaires, the parents need to answer you are the student father or you are the student mother, and through this information we can define you. We can define the student is to father sample or the mother sample.
So just to clarify, so basically, whoever answers the survey. So if I answer the survey and I'm the father, and the survey asks me, "Are you the father of the child?" I say yes. I will be answering all the remaining questions about stereotype and about everything else. Okay. So it's only either the father or the mother who respond. There's never overlap, right?
Yeah. But exactly. We have exactly. But we have the father. But we have both the fathers and mothers' education, because in the student questionnaire, the student needs to answer. Your father's education and your mother's education, and your father's occupation and your mother's education.
That's right. That's right. But I guess your point is also, it's very important to distinguish who's answering the questions about, because the bias question are subjective. And so, even if you ask me about whether my wife has a bias, it will be reported with error. So it's only about subjective. I mean, I guess the subjective questions are reported by the respondent. Okay, very good. Are there other questions for Shui? Still have a few minutes. So maybe because you mentioned, I think it's very interesting that you have siblings here. Not just going back to the, to the aspect of the one child, which still stays. Actually, the opposite, about social interactions and trying to understand, obviously here in the data, you can't identify whether the child has responded or can you? Do you have an identifier? So if the father is interviewed and you have two kids in the same sample, can you identify them both? I guess not.
No.
Okay, very good.
Yeah,
well, very bad, but very good. I mean, obviously, so all you can do is probably look at number of siblings and their gender composition.
Yes.
And whether the gender composition influences your happiness via the, the sort of stereotype of parents. There's a bit of, not heterogeneity necessarily, there's a bit of, I mean, the causality chain there is a bit obfuscated, but I think correlations would be very interesting to look at, right? On the side of how horizontal, sort of transmissions and changes affect, because we know, I have a paper recently, I mean, it's on the US, but that shows that actually depression is contagious, and it happens through your network when you're young in schools, and with your sisters and brother could be the same. If your brother or sister are depressed, right, or are sad, then you're likely to be the same. And so basically using that information, you can understand how much that affects directly your happiness, and how much that affects your happiness through your parents' stereotype, basically. So I think that's something interesting to explore.
Okay, thank you.
Yeah, sorry, I have hijacked the session. I mean, we still have 15 minutes for questions. So, if there's someone who wants to ask more. Oh, I think there's another question here. How do you pick the sample, and how do you select the sample? I guess.
Okay. It's not complex. I just in the sample selection, I just delete some variables mission, such as parent education mission or the parent's occupation mission, and I drop this sample. I just delete the information miss and do not do some other selection.
Okay, I guess this should answer the questions, hopefully. Okay, so let's wait maybe 1 or 2 minutes to see if there are additional questions. Failing that, we can move to the next paper a little bit earlier. Okay, then. Okay, Shui. So thank you very much for your presentation. It's an interesting paper, and wish you and your co-authors all the best with it. And looking forward maybe to see a discussion paper in the GLO series sometimes.
Okay, thank you.
Very good. So if I can ask you to de-share your screen, and then I'm going to ask Rufei to chip in with his paper. Rufei, are you ready?
Hi.
Hi, Rufei. Hi. Are you ready to present now? Yeah.
Yeah. I will try to share my screen.
Very good. So you have a paper on fertility here, together with Junsen and Junzhen, and floor is yours. You have half an hour, and then if there could be questions in the middle, but I guess like before we leave them at the end. Okay. So floor is yours. Thank you.
Okay. Thank you for your introduction. Yeah. So it's an honor to be here to present my paper. Again, actually, I have attended the Renmin GLO Conference 1 or 2 years ago. And this is a joint work with Professor Yijun Jian from the Chinese University of Hong Kong and Professor Zhang Junsen from Zhejiang University. Let me try to see. So in the online presentation, I have the advantage to use the pointer to maybe to do some highlighting. So I will try to make it a red point. Okay. So ever since Gary Becker introduced fertility into economics, economists have considered fertility as a human choice, right? So the cost and the benefit of children will determine whether you will have an additional birth. However, in the real world, not infrequently, people cannot achieve their preferred fertility level. So in some cases, people may have unwanted birth. Right? They may try to use some contraceptive, but it fails. So maybe luckily or unluckily, they have some additional children, unwanted birth. And for some people, it's the other case. They may not be able to give birth. They want some children. However, they are not fertile enough to give an additional child. And this kind of infertility may not be curable. So the medical treatment cannot help them have children. And in China and India, we know that forced sterilization once prevailed, such as the one-child policy. In some areas, in the urban areas mainly, people can only have one child. If you want to have additional children, then maybe you will be be forced to give up your child. So in these cases, fertility is rationed. It means that the number of children you have is outside of your control, outside of an individual's control. It's determined by external forces. So in many cases, fertility is rationed. So our research question is, how does rationed fertility affect human capital investment in children? This is actually a very classical question. The seminal contribution is Becker and Lewis' JP paper, right? That predicts they predict a negative correlation between child quantity and quality when parents' income rises. They're trying to explain the demographic transition, and they have derived the negative correlation between the number of children and the average quality of children. Then labor economy is trying to identify whether an increase in the number of children would reduce child quality. The findings fall into a very wide range. But some studies found a negative quantity-quality effect. By quantity-quality effect, I mean the effect of an increase in the number of children on some indicators of child quality. Usually, years of schooling would be a very common indicator of child quality. And also some studies have found zero quantity-quality effect. And more recently, two papers have found heterogeneous quantity-quality effects over different dimensions. There is a gap in the literature. We know that Becker and Lewis predict a negative correlation between child quantity and quality. However, as labor economists, we have tried to identify the causal effect of some exogenous changes in child quantity on child quality. And the gap is that actually in the theoretical analysis, there is almost no comparative statistics on the effect of child quantity on child quality. So in Becker's original paper, they just derive a correlation. That's not it's not that you try to derive an exogenous change in child number and then check the effect on child quality. Right? So I should say that the existing empirical findings are largely irrelevant to the QQ theory of Becker and Lewis. So what we do, we derive a generalized theory of rational fertility to analyze treatment effect heterogeneity in the child quantity-quality trade-off. And we test our theory of rational fertility using a combination of China's one-child policy and the natural experiment of twin birth. Actually, we try to combine two experiments to test the theory of rational fertility. So here comes our theory. we actually use the original model of Becker and Lewis. The model is quite simple. The parent would derive utility from the number of children, the average quality of all children, and also a composite consumption good. The budget constraint is the budget constraint differs from the traditional linear budget constraint. So there would be a cost of the number of children, a cost of child quality, and also a cost of the multiplication of the two terms. Why there's an interaction term, I will explain that by using, so let's just derive the price of child quality. You will take, you can just use this term, take derivative with respect to Q, then you can obtain the cost or the price of child quality. The first part is the pi Q is the cost of public goods or feminine goods. It means that this part of the cost of child quality is unrelated with the number of children. So it's like some aspect of training at home. You can train all your children at the same time. Maybe you teach 2 or 3 children, there are not a big difference. And you can handle, there will be some handling down of clothing from older brother to the younger brother. So to increase the average quality of children, part of the cost is is unrelated with the number of children. However, a major part of the cost should be increasing in the number of children, the cost of private goods. For example, the tuition fees, when you have more children, all of them attend college, then you save for each of the children. The tuition fee is the education. The tuition fee for education is kind of a private good. And also the healthcare expenditures, right? So when each of your child gets sick, you need to cure them for privately. You need medicine, you need to take them to hospital. So the key point is that when the number of children increases, the price of increasing the average child quality would increase. So that's the key point of Becker's original paper. That's why he derived a negative correlation between between the number of children and the child quality, because when you have more children, it will be more costly for you to increase the average child quality. So as the number rises, quality would decline. So in Becker's setup, the number of children or child quantity is also endogenous. It's a choice variable. People can choose the number of children. Similarly, we can derive the price of the number of children. Part of it is not related to the quality, since you need to spend a fixed amount of time to give birth, and it also captures the necessities to keep your children alive. Then similarly, if you want children of a higher quality, then the cost of an additional child will also increase. So child quality is also part of the price of the number of children. Well, to have an additional child, you can also derive some benefit. Right? That's why you want children, right? Otherwise, it's very costly. It's really costly, time-consuming. You want children, so it must be the case that an additional child can derive some benefits. We use the VN to denote the marginal utility of an additional child, measured in dollars. Right? We will divide it by the marginal utility of $1, the shadow price of income. So parents would choose their optimal number of children by equalizing the marginal return and the marginal cost of an additional child. Well, in Becker's original model, actually, you cannot derive the effect of a change in N on Q because N is endogenous. Then Rosenzweig and Upin, they are the first to derive the effect of a changing n on Q. They try to treat the number of children as a parameter. So I use an upper bar on n to mean that now n is a parameter. So once n becomes a parameter, then you solve the model, you can derive the comparative statistics of rational fertility on child quality. So Rosenzweig and Upin are the first to do that. And they try to evaluate the QQ effect at optimal fertility level. So they connect this the model of rational fertility to Becker's original model, and they evaluate the comparative statistics when the rational fertility equals optimal fertility. Now, our contribution is to generalize Rosenzweig and Upin's paper. We derive the effect of rational fertility on child quality at any possible values of child number. We find a new rationing income effect, which has not been identified in the literature. And the rationing income effect has clear predictions on the heterogeneous quantity quality effects. So finally, we have some works on theory, and then we derive this equation. So this is the quantity quality effect, right? The change in n on Q. And it can be decomposed into 3 parts. The first part is the price effect. It's actually the Hickson substitution effect, because the number of children is part of the price of average child quality. So when the number of children rises, the price of child quality would increase, and it will reduce the demand for the quantity of children. That's essentially the Hickson substitution effect. And that's the original contribution of Becker and Lewis. Then we also derive a substitution effect. The substitution effect arises because the number of children as part of the price of child quality directly enters parental utility function. So in a standard utility maximization problem, a price will not enter the utility function, right? Only the amount of the commodities would enter the parental utility function, but the price will not enter parental utility. But here, the number of children is part of the price of child quality, but it also enters the utility function directly. So there would be a technical substitution effect. And the substitution effect is not present in the standard Slavsky equation, because in the standard utility maximization problem, the number of children is not part of the, does not directly enter the utility function. Okay, the substitution effect has been derived by Rosenzweig and Upin. They are the first to derive the substitution effect. Well, we derive a new rationing income effect. The rationing income effect composed of 2 parts. So the negative part is similar to the income effect in the Slavsky equation. So it's just you want to have more children, then to sustain your original consumption model, you need to spend more money. So there should be some compensatory income change, essentially the same as the standard textbook analysis. The new term is this VN term, right? It means that if you have more children, it will raise your social income. It will increase your utility level, which will have a positive rationing income effect. And in combination, whether the effect is positive or negative, we do not know. To further explain the rationing income effect, we can actually use the concept of social income in Becker, and we can derive. So this is a social income, and we can derive that the rationing income effect is actually, so the magnitude of the effect is determined by if the marginal utility or if the marginal return of additional child is larger than the cost or not. So let's have a detailed explanation using this figure, right? So this NO is the optimal fertility. if fertility is a choice, people would desire NO. They want to have NO amount of children. But maybe because of whatever reason, they cannot achieve this NO, this optimal level. For example, if we have one-child policy, right? You want 3 children, but in the rural areas, usually people can have 2 children, but not 3 because of the policy restrictions. So because of policy restriction, you cannot obtain your desired level. But maybe luckily, suddenly you have a pair of twins. Then the twinning would help you break the restriction. Then luckily you can move from NO-1 to NO. This would be a desired fertility increase. Right? It will help you move closer to the desired fertility level. Then this desired fertility increase can actually raise your social income because the marginal return of an additional child is actually larger than the marginal cost. So this desired fertility increase will generate a positive rationing income effect. So another case is that initially you may already have more children than you want. Then you have a fertility increase. The increase would be undesired. For example, you just increase from NO to NO+1 to move beyond your desired level. Then this undesired fertility increase would have a negative income effect. So I've tried to do a simulation to illustrate the 3 effects. So we just follow Morgenstern and Wiswell's paper, and we adopt a nested CS structure. So here's the simulation results. This line is the quantity effect, the overall effect. We decompose it into 3 components. The price effect is always negative, and it tends to cancel out with the substitution effect. Then we can see that the income effect follows strictly the overall shape of the QQ effect. We do the simulation just to illustrate that it's possible that the income effect drives the QQ effect. Then we would like to test our theory. So the main theoretical prediction is that the type of the fertility change will determine the QQ effect, right? If it's a desired change, it will have a positive rationing income effect. If it's a undesired change, then it will generate a negative rationing income effect. So we want to differentiate between the 2 types of fertility changes. How we can do that? So here is our identification strategy. Our econometric framework builds on the literature of multi-valued treatments, quite recent literature. So in our setup, we will consider an instrumental variable that is twinning at a second birth. When z equals 1, it means that we have twins. Also, we have a stratifying variable, the birth control policy. Then we consider 3 types of mothers. The mothers can have either 2 or 3 children. So we need to consider 4 scenarios, right? The policy can be absent, or we have the birth control policy. And we can, the parents may not have twins, or likely they may have a pair of twins. No twins. So without twinning, we assume that when the parent do not have twins, and when the policy is not there, all mothers can achieve their optimal fertility. And type A mothers would desire 2 children. Type B and type C mothers would desire 3 children. So this is a simplifying assumption, right? Without the constraints, without twinning, without policy constraints, all mothers can have their desired fertility level, the optimal fertility level. They want either 2 or 3 children. So without policy, if parents have twins, then type A mothers would be the compliers. Since they originally have 2 children. If they have twinning at the second birth, we are considering twinning at the second birth. So if they have twinning at the second birth, their fertility would move to 3. Since you have second-born twins, so suddenly you jump from 1 child to 3 children. So they are the compliers of twinning at the second birth. For type B and type C mothers, they will not comply, right? They are always takers, since they would always want 3 children. If they have twinning at the second birth, they would still have 3 children. No difference. Then the policy, we are considering a policy that targets at 2 children per family. That's actually the case in rural China. The policy would ration fertility for type B mothers, means that type B mothers are compliers of the policy. So without policy, type B mothers would want 3 children. With the policy, type B mothers would comply with the policy and only have 2 children. For type C mothers, they never comply to the policy, right? So even if you have a birth control policy, there would be some mothers who would always have 3 children, regardless of the policy, regardless whether the policy is there or not. Okay, so type B mothers would comply to the policy. Then under the policy, twinning would increase fertility for both type A and type B mothers. Type A mothers would always be compliers of twinning. They desire 2 children. So they would always be shifted up to 3 children by twinning. And under the policy, additionally, type B mothers would also be the compliers of twinning. So the policy restricts their fertility to 2. But luckily, they have a pair of twins, and the pair of twins would help them break the policy and achieve the desired fertility level of 3. And we also assume that in the population, the proportion of type A mothers is PA, the proportion of type B mothers is PB, and also for type C mothers, their proportion is PC. Based on the above derivations, we write down the fertility equation. So D is an indicator that equals to 1 if mother I has 3 children and 0 otherwise. And Z is the indicator of twinning. X is the indicator of the policy. And we have proved in our paper that the coefficient on Z actually equals the proportion of type A mothers. It's easy to understand, right? So you just set X to 0. Then the effect of twinning on fertility would be alpha 1. Then we know that without the policy, X equals 0, it means without the policy. Without the policy, type A mothers are the only compliers. So alpha 1 would equal PA. And also we have proved that alpha 2 equals PB. So actually in the econometrics, we have also made some assumptions. We have made standard IV assumptions on our twinning instrument. We assume independence, exclusion, monotonicity, and relevancy. And we also make an assumption on the policy variable. It's weaker than the assumptions on instrumental variable. Our assumption is that the policy will not change the average treatment effect for each type of mothers. Well, we would examine the robustness of this assumption in our empirical analysis. It actually allows treatment effect heterogeneity, right? Firstly, we allow heterogeneity for different type of mothers, and also within each type of mothers, we allow heterogeneity for different individuals. We only assume that the average treatment effect for each type of mothers is orthogonal to the policy. So we can just get out this policy variable from the average treatment effect for each type of mothers. So it's not a very strong assumption, actually. Then we can also write down the child quality equation. We put child quality, an indicator on child quality on the left-hand side, and on the right-hand side, we have twinning instrument and also the policy variable. And we have proved that the coefficient on the twinning indicator equals PA times the average treatment effect for type A mothers. And rho 2, this coefficient on the interaction term, would equal the average treatment effect on type B mothers times PB, the proportion of type B mothers. Then by some simple algebra, we can show that we can actually identify the quantity-quality effect for type A mothers by dividing these two parameters. We can identify the effect of twinning-induced undesired fertility increase on child quality. And also for type B mothers, actually this is the quick effect for desired fertility increases. And our theory would predict that the rationing income effect is negative for type A mothers, and it would be positive for type B mothers. So the difference for the two effect, for the two QQ effect, should be positive. So for type B mothers, we should have a larger QQ effect than for type A mothers. That's a prediction of our theory. And we want to test this inequality in our empirical analysis. So because of the time limit, I will briefly cover my the part of the empirical analysis. The first thing I want to say that actually the birth control policy, the so-called one-child policy, is not a one-child policy in rural China. The dark line, the black line, is the proportion of mothers with at least 2 children. You can see that over 80% of the mothers would have at least 2 children in rural China. And so actually in urban China, it's a one-child policy. You can see that the proportion of mothers with 2 children declines sharply. But in rural China, it's actually a 2-child policy. The proportion of mothers with 3 children declines sharply, right? But for mothers with 2 children, nearly everyone has 2 children in rural China. So our primary data source is the 1% sample of the 1982 and 1990 China population census. This is publicly available data from IPOMS. You can download the 2 micro samples. And we restrict our sample to rural mothers, Han ethnicity. And we will examine the outcome of first-born child, aged between 13 and 17. For them, middle school attendance should be the sensitive education outcome. And we require all children to coincide with their parents, and we drop Tibet. So here's the empirical counterpart of our of the previous 2 equations. And so we use tuning at second birth, and we will construct a variable on the stringency of the birth control policy. It's actually the fine for excess birth. And the education outcome we use is middle school attendance. And you can see that in our sample period, nearly every child has attended primary school. So primary school attendance is not a sensitive outcome. And also for high school attendance, the rate is not that high. Then middle school attendance should be the sensitive outcome. So we use middle school attendance as our primary outcome of interest. And we use children aged between 30 and 17 when they are actually on the way to attend middle school. For older children, the problem is that they may have left home, so we cannot use older children. And this is the policy variable we use, the fine, right? Maybe most of you are familiar with this figure, right? This is collected by Epstein in his JHR paper. And you can see that there are substantial variation of the fine variable over province and year. And we map the fine data to each mother, right? We know when they give the second birth. So we use the weighted average of the fines in the 10 years following her second birth. So it's actually the stringency of the policy for her third birth, this target at our empirical strategy. So I'll jump to we have also checked whether our tuning variable correlates with some socioeconomic status of parents, and we see that tuning is strongly correlated with the maternal age at the second birth. It means that when you give birth older, you are more likely to have twins. This is in the literature, so we have control for this variable. But we've checked that tuning is essentially not correlated with other variables, including the gender of the firstborn child or the amount of the fines. So our empirical analysis has lend some support to our theoretical analysis. We have really found that the QQ effect for type B mothers is positive, and the QQ effect for type A mother is negative, and the difference is positive. So this is actually our theoretical prediction. We have tried to include some province-specific quadratic trends. If we include linear trends, the results are similar. And we have control for some GDP growth and population growth. We have done quite a lot of robustness analysis, controlling for a related birth control program, the Later, Longer, and Fewer campaign. We control for the supply of education. We control for some historical events like famine and Cultural Revolution. And we found quite robust results. We've also done heterogeneity analysis. We found that the rationing income effect seems to be more pronounced for sons. And the effect is stronger for mothers with low levels of education. Maybe for poor families, the rationing income effect is more pronounced. We have also tried to check some other things, which I will skip. And in conclusion, we have tried to identify the differential treatment effect between desired and undesired fertility increase on child quality. So generally, for each treatment, for each policy, there should be some compulsory and voluntary dimensions. For the RCTs, most of them are voluntary, so we expect it to have some positive income effects, since people who get enrolled actually benefit most from the RCTs. But in real world, we also have compulsory policies, such as the one-child policy, which will generate a negative income effect. And our study is not just about the identification of some causal effect, right? We are trying to use economic theory to understand treatment effect heterogeneity. We are trying to do some empirical analysis to test our generalized theory of rational fertility. So thank you. Comments are welcome.
Thank you, Rufei. Again, a very clear presentation. Are there some questions from the audience for Rufei? Okay, maybe I can start with one. Can you help me a little bit interpreting those QQ parameter? Because, you know, it was really, you rushed a little bit. When we look at the outcome as, this is enrollment, right? The outcome that you're looking at, right? Can you help us interpreting those parameters? I understand the difference, you know, between the two type A and type B, but you know, how big is the effect, basically, economically speaking?
Yeah. Actually, we think the effect is quite large. I will try to share the screen. So here is our baseline results, right? So if you look at it carefully, so let's first look at the results for the fertility equation. So in panel A, the outcome is whether they have 3 children or more. And we see that when phi equals 0, it means that there is no birth control policy. Then tuning would shift up fertility by maybe 23%. Then when we have the policy in when phi equals 1, then tuning would have a larger effect on fertility, because now we have the type B mothers have been shifted down, then they have been shifted up, so there are more compliers because of the policy. Then we have the fertility equation, right? So if we divide this 0.23 by this, we divide this 0.033 by the 0.23. Then we get this beta A, right? Beta A. It means that if you have one more child, then the child is 15% less likely to attend middle school. So it's actually quite a substantial effect. It's a negative quantity effect. Then if you divide this parameter by this one, you would get the quantity effect for type B mothers. It's the effect for desired fertility changes. And the effect is quite large, I should say. It's 42% increase in the likelihood of attending middle school. So difference is also quite large. I should say that, so when I first looked at this large effect, I was surprised. Then I think about have some about it. You can think the number of children, right? Children actually is a very substantial share of family budget. So when you have more children, actually you need to spend a lot of money on that. So the income effect. So in our standard scholastic equation in the textbook analysis, when I teach my students, I would say that we can decompose an effect into a price effect and the income effect, and in most cases we can neglect the income effect because most of the commodities in real life just consumes a very small part of your overall budget. But two things are exceptions. That is the house and children. People will spend a quite large proportion of their income on housing and on children. So once we think about children, you have some unexpected birth of children, then you have a quite substantial rationing income effect. So that's why we can have some large difference because of the rationing income effect. Yeah.
Okay, thank you for the explanation. More questions?
Hi, Rufei. So I have a question about the definition of twin occurrence. So in your study, did you take into account of the man-made twins as proposed by Huang Wei and his co-authors?
Yeah, that's a very good question, and I actually expect this question to come. Yeah. So actually, we cannot distinguish between real twins and man-made twins because in census data, they are twins if they have the same year of birth and month of birth, right? So so actually Huang Wei found that people tend to report regularly spaced siblings as twins. If they do this fake reporting behavior, then we would identify them as twins. So actually we cannot get rid of the man-made twins. However, our study, I think is not a big concern in our study. For one thing, our sample is the early waves of sensors. So in Huang Wei's paper, they find fake twins mainly in later waves. So that's one thing. And secondly, we have checked the correlation of our training variable with. Yeah, here is the table. So the dependent variable is training at second birth, right? We would regress the training status on maternal age at second birth, parental schooling years, and whether the firstborn child is a son, and the amount of and the stringency of the one-child policy. So if the fake twinning is a big concern, then we would expect that if the parents have firstborn daughters, they should be more likely to have fake twins. And if the one-child policy is, if the fine variable is larger, right, the one-child policy is more stringent, then they are more likely to report twins. But the coefficient on these two variables are not significant. And combining with the fact that we use data from earlier waves, right? We use the earlier waves of sensors. So we think that fake twinning should not be a big, they should not have a big presence in our data. And the last thing is that we are interested in the interaction term, So at least for the interaction term, we have tried to difference out we are actually differencing two QQ effects, right? So if they are fake twinning and they bias the two effects in the same direction, then there should not be a big problem.
Thank you.
Okay, thank you.
I have a question. Can I? Oh, Ru Hui, I'm wondering why you don't consider the cases that the couples just want one child or they don't want any child. Why these cases are not considered here?
Yeah, that's a good question, a very good question. So in our sample, we have tried to restrict sample to mothers with at least 2 children. So if they do not have any child, or if they only have 1 child, they are not in our sample. So for one thing, we wanted to use twin birth, right? So if they have no children at all, they absolutely they will not have twins. So parents with no children cannot be used. And for parents with 1 children, actually there should be, it is possible. So if we examine twinning at the first birth, then actually we can include parents with only 1 children as a comparison group. But the problem is that if we use twinning at the first birth, then we have to compare the actual twin children with non-twins. So that's a problematic comparison. So the treatment group should be parents with firstborn twins. So in their family, they have twins. And the comparison group is parents with only 1 children, no twins. Then we have to compare the firstborns, right? We have to compare the firstborn twins with the firstborn singleton. That's the problem. So the preferred empirical method in the literature is to use twinning at the second birth. Then they can compare the first child, the firstborn child, who are not twins, in family with twins and without twins. So that should be a better comparison. So we use the rural China sample, and we use parents with at least 2 children. Yeah. Thank you. Very good question.
But empirically, those women, those couples who prefer 2 and more children may be different from those couples who prefer less children. Then the sample may be selected, right?
Yeah, sure. The parents with at least 2 children should differ from those with only 1. So, but in our treatment and control groups, all of them have at least 2 children. So yeah, we are not trying to identify the QQ effect for the whole population. We use a subsample, for which we can have a clear identification of the treatment effect for this subsample. And we are trying to test our theory using this subsample, which we can obtain a clear identification of both types of effects. Yeah.
Okay, thank you.
Yeah, I guess one way to see this is that it's a local average treatment effect of, because, right, obviously, because, but that's what you're identifying is it's comparative statics, right? Like you say. So basically, the only people who are changing preferences are those mothers, right? Everything else stay, right? Preferences for mothers with 1 child are stable, right? Basically during this period, are unaffected by the policy and are unaffected by anything else, right? That's I guess the way I would see it.
Yeah. Luffy, can you go to your table, your regression table?
Okay.
It seems like your results are mainly driven by the interaction term, the coefficient between the interaction term, right? 1 and the twins. But in this case, if there's no one-child policy or family planning policy, then the twins coefficient between twins captures the effect without one-child policy. We compare family with 2 children and family with 1 child and then the twins. But after we have one-child policy, if we only restrict to the sample with at least 2 children, then actually this sample actually is selected, because at least we have one-child policy. Then most families are supposed to only have 1 child, but here you only restrict to family with 2 children, right? Then I think if your results are driven by this different type of children, then
well, you can look at this figure, right? So we are using the rural sample. So actually in rural China, most parents would have 2 children, right? So this is the proportion of mothers with 2 children. So in urban China, well, the proportion of mothers with 2 children declines sharply. But in rural China, at least over 80% of mothers have 2 children. So yeah, there should be some selectivity, but I think the selection is not severe since actually most of the sample mothers would have 2 children in rural China. So that's why we do not use urban China. We use rural China. I don't think the selection would be that severe. Yeah.
Okay, I get it. But it seems like I cannot come up with a new story that explain a result. But I still think your theory is trying to explain this result. But your theory relies on that every mother have the optimal fertility, right? But it seems like that your optimal fertility doesn't change on the different policy. But if we believe that actually how much children do you prefer, actually that depends on how much children your neighborhoods have, then actually your theory is kind of ad hoc. I mean, and your theory can only predict that one coefficient is larger than another coefficient. I think we can come up with a lot of theories which could potentially explain the coefficient difference. So how can you provide any other testable prediction from your theory, and then we can be convinced by your theory is true? I mean, because this is very indirect test, we only have this beta B is bigger than beta A from this theory. But can you generate other testable predictions from your theory?
Yeah, for one thing, so the most difficult part for our analysis is that we cannot observe the optimal fertility, right? We cannot observe their desired level. And so we can just infer from some test. We combine 2 natural experiments and we get some results. We say that the result is consistent with our theory. I think we have done some heterogeneity analysis that is maybe can support our theory better. So here we try to have the mother with low levels of education and high levels of education, right? Since it's an income effect, we should expect that the income effect be more pronounced for poor families. So for mothers with low levels of education, actually, we have better estimates, although it's only marginally significant because of the smaller sample size. But the results are mainly found for mothers with lower levels of education, for poor families. So I think so the income effect is more important for poor families. I think this kind of is a partial support for our story.
No, but still, I think the optimal fertility should be depends on how much children your neighborhood have. And
yeah, that's
another issue is that I think twins actually is always different from have extra 2 children. I mean, if you have twins, extra is the extra thing. I can understand you use standard exhaustive variation to have 1 extra children, but I still think that might be problematic. If you have twins, you might deal with the twins differently from other situations.
Yeah, I agree. Actually, there are quite a large literature discussing the problems with the twin instrument. They're trying to, I myself have a paper trying to attack the twin instrument. So if you want to use the twin instrument to identify some level effect, I think that should be truly problematic. The twins have lower birth weight than ordinary children. Right? They have 0 birth spacing, and healthier mothers are more likely to have twins. Since if mothers have poor health, they cannot support 2 children at once. Right? So twins, the families of twins actually differs from that of lone twins. But in our test, actually, we are trying to check a difference of 2 quantity-quality effects. I think that should partially cancel out any potential concerns with the twin instrument. We cannot actually fully solve the problems with the twin instrument. But I think our empirical strategy, the difference of 2 effects, should be so the problem of the twin should be a less concern. Yeah.
I think if preferences, if fertility preferences change in the same way across the treated and control group, it's not a problem. The
Yeah,
problem
yeah.
But my concern is that twins family is always quite different from non-twin families.
No,
so
that's okay, but
even
that's
if your result is true under twins families, but what happens to non-twins family, we don't know, right? This is a very special kind of family because they have twins.
But that's why it's a local. This is a local average treatment effect. Is only valid for basically this result is only valid for those selected, right? For basically those particular families. You cannot externally validate.
This is an internal external validity issue.
Sure.
But I do think the point. It's a fair point.
This is a very nice paper. Yeah.
It's a fair point that those fertility preferences could change endogenously. And I think if you want to, to make that point clear, that it wouldn't be problematic to your design if those preferences evolve similarly for both groups, right? And if they do, it doesn't threaten your identification. It might, it might means that you cannot control for it, but basically, and it might bias somewhat your parameters, but not the difference, right? So.
Yeah. Sure. So for Xianxiang concern, the neighborhood effect is also this type of concern. Yeah, I think the difference can partly address this concern. Yeah. Thank you. Really good questions.
Very nice paper.
Are there other questions for Rufei? Okay. Then if not, I think I need to pass the floor to Zong for concluding remark, right? I think we finished the second sessions and was a nice sessions with a lot of nice papers and a lot of questions. So thank you to all the presenters and people from the audience who have asked questions. So Zong, the floor is yours now.
Okay, thank you, Corrado. Thank you, everybody. I think we have a very productive conference. Unfortunately, because the COVID-19, we cannot, meet in person, and but fortunately, rely on the technology. We still can exchange ideas and also can communicate the each other's research work. I hope next year, and the pandemic will be end, then we can have an opportunity to meet in Beijing. I'm really looking forward that to all of you to have the chance to come to Renmin next year. I want to thank Emmet Lu and Li Qiu to put up the program, and thank you, Corrado and Li Qiu, to chair the sessions. And once again, thank you all the participants, the presenters, and also the audience. And the last, would like to welcome Klaus to conclude the workshop. Thank you, Klaus. Now it's your turn.
Thank you very much, Zong. I'm very happy that this was possible. We don't accept global challenges, whatever they are, including COVID crises. And I think exchange is very, very important, particularly in those times. That's why I was very happy that the Q, Song, Guadalupe, Corrado were willing to team up and save our tradition of the GLO Renmin University long-term collaboration. And we see there are lots of interesting topics which are of relevance. And to be honest, I mean, the number of participants at this workshop was significant. Yes, it was an internal workshop, but we had about 60 or so people registering, and at most, I think 40, 42, 43 people participating. That's what I saw. So that was as a proof that it's possible to do these things even under these constraints. And I hope about some of the research of this conference is already coming into the GLO discussion paper series. Others are invited, of course, and of course we hope that we see many of these papers, which I found all very excellent, to get published at some time somewhere. So we have our duty done. Now maybe next time we had one mistake at lunchtime or dinner time. We could have had more exchange between us. So we should have brought all our cups of Chinese tea, with Chinese tea, to have a tea party at least. But next time we can do that. And I invite you to look out for more GLO events over the next months until the pandemic is over. We will have many of these kind of workshops in other continents and other themes, and hopefully we can see some of you also coming. Okay, thank you very much. Best wishes for nice holidays, the new year coming, and in various steps now. And hopefully we all get over, as China already did, but in other parts of the world, get over of this pandemic crisis. The vaccine is coming, and hopefully we all will get it at some time. Okay, thank you very much. Enjoy the next weeks and be in touch.
Thank you. Thank you.
Thank you.
Bye, everybody.
Bye.
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 Thank you.